welcome to the Stage 3 Emergency Aid Badge. My name's Paul and I'm a first aid instructor. I own my own first aid training company. I'm also a cub leader here in Windsor where I live. So I train beavers, cubs and scouts as well, and also a lot of leaders as well. So we're going to do the Stage 3 badge today. Now this is more aimed at scouts. We've done Stage 1 and 2 for cubs and beavers. Also for scouts that have never done any of their emergency aid badges before. But we're going to deal with this on a slightly older age group. The course is about 2 hours long, so feel free to drop in and out, but as long as you complete the course, that's all that matters. So what we're going to be looking at today is I'm going to have a look at what your role is as a first aider, what we're there to do. We're also going to have a look at keeping you safe and also our initial assessment of a patient as well. Then we're going to have a look at how we deal with somebody that's unconscious, somebody that's not responsive. We're going to have a look at what happens when they're breathing and also when they're not breathing as well. We're also going to have a look at defibrillators in there as well because they are becoming more commonplace. You do see them around a lot more and you can use them. So we're going to show you how to use one of those as well. We're also going to have a look at how to deal with bleeding. So we'll have a look at a couple of scenarios there, including a quite serious bleed that we've filmed outside in a bit more of a natural environment. We're also going to have a look at burns on how we deal with those. Then we're going to move on to the heat-related problems. So we're going to have a look at heat exhaustion, heat stroke, and also hypothermia as well. Then we're going to have a look at our breathing problems. So we'll have a look at what happens when somebody's having an asthma attack and also when somebody's choking as well. During the course, we're going to hopefully get you involved in making a few things. So when we do the CPR, we're going to have a look at how we make a mannequin because I can't bring all my equipment to you now. So we're going to have a look at what we can make to make do whilst we're at home. I think it's one of the great things whilst we've been locked away is that we've been able to adapt everything, and I think that's one of the great resources of Scouts. So we'll have a look at that, and then we're going to have a look at making a choking vest when we get into our choking section as well. At the end of the course, there will be a worksheet for you to complete or an online quiz as well, which you'll be enabled to send something to your leader just to make sure that they know that you've completed the course. So we really, really hope you enjoy it. Get involved, do all the practical work. That's the really important thing with first aid, that you've practiced it before you have to do it, and we hope you enjoy it. So let's have a quick look at what we're there to do. So what is our role as a first aider? So when we break it down, we've got three really, really important things to do. Okay, we call it the 3 Ps. Okay, so the first one, the biggest thing, is to keep them alive. Preserve life. Okay, we're there to keep them alive. That's our basic role in first aid. We want to keep them breathing till we can hand them over to the paramedics. The second one is preventing the situation from getting worse. And to be honest, a lot of the time, that's what we do. You know, if somebody's bleeding really badly, guess what? I can't actually fix that. All I'm going to do is put some pressure on it and stop it bleeding, keep it clean, bandage it and get it to hospital where the doctors can sort it out. We're not there to fix things. We're there to stop it from getting worse, prevent worsening. And then the third one, we're there to promote recovery. Everything that we do, we want to be pushing the patient in the right direction. We want things to get better quickly. So it might just be reassuring them, looking after them. It just prevents it from getting worse, but obviously it makes them better. So that's our role as a first aider. Preserve life, prevent it from getting worse, and promote recovery. 3 Ps. So before we start to assess a patient, what we've got to do is make sure that we're safe. So we've got to be able to have a look for dangers when we do a scene assessment. So what we're going to do is we're going to have a look at some video that we shot during lockdown with my 2 boys. William is a scout and Alex is a cub. So they're well used to the emergency aid badges and they help me along the way. So the first scene we're going to have a look at is one of the live shots that we did during our filming. And this is where Alex is going to walk into a room and look for 5 hidden dangers. What we'll do after that is we're going to show you a short clip of William rushing into a scene and not doing a scene assessment and getting in a bit of trouble. So have a look, join in with the danger detectives and make sure that you're safe before you start to assess the patient. So what we're going to do now is the first thing that we ever do when we get stuck in with first aid is we need to make sure that you are safe, okay? You are the most important person and we're going to look after you, okay? So what we've done, and I don't know if you've noticed it yet, we've hidden 5 dangers in our classroom today, okay? And we want you to be danger detectives. You're going to walk in, and if something doesn't look right, you're going to have a good look around to see if there's any dangers around you there, okay? So I've got my second little helper, Alex, okay? So come on in, Alex. So come and sit down here, Alex. Okay. This is Alex. Alex, how old are you?
I'm 8.
You're 8, and have you ever done any first aid before, Alex?
I haven't beavers, but not, well, I haven't cubs.
Yeah.
And not anywhere else.
And have you ever hurt yourself where you needed first aid?
Yes, when I was very little, I broke my foot.
You broke your foot, and how did you break your foot?
I went to my friend's house and fell off their tree house.
Yeah, exactly. And I think William hurt himself at the same thing at the same party and ended up in hospital as well, didn't he? It was a great party. Right, so Alex has walked in. Now, Alex, we've got 5 dangers to spot. Now, William, are you ready with your buzzers? So if Alex gets the right one, you press the orange, and if you get something that's not dangerous, then you press the purple one. So Alex, see if you spot any dangers.
The snake.
Yes, we've got a poisonous snake hanging from our banner today. Well spotted.
Electric wire.
The electric wires, yeah, absolutely. Good boy.
Glass.
Yeah.
Water.
Yeah, so a wet floor from a spilled glass as well. Yeah, absolutely. Sorry? You've got the electric.
Chainsaw.
Yeah, I think Daddy's been doing his DIY today, hasn't he? So, yeah, we've got our chainsaw, which is definitely a bit dangerous, that one. We'll get rid of that. And we'll get rid of the electricity. Anything else? What might cause somebody to be hurt?
Glass.
Yeah, that's right. So that's the really hard one, isn't it? We've got a cup of really hot coffee just standing there in our lovely green box mug, just sitting there. So if we were to get up and bang that, we might spill really hot liquid all over the place. So boys and girls, how did you get on with that? So did you manage to spot all 5? I think some of them were really obvious. Some of the things that you look at when you walk into a scene are really obvious, but sometimes it's the little things like the cup that will trip you up, okay? So always look where you're kneeling, always look where you're putting your hands, always look where your head is as well. So it's always a good one. Come and have a sit down for us, Alex, there. So fantastic. So we are now danger detectives. Every time we walk in to do any first aid, make sure that you are really, really safe before you do anything. So that was Alex looking for dangers in our virtual classroom. So what we're going to do now is show you what happens when it goes wrong. Rushing into a scene is always a bad idea. People don't die in seconds. You've got time, 5 seconds, just to have a look around you. Make sure that you stop, think, and then act. We want you to act on a thought, not on an instinct. Instinct in this situation is bad news. So make sure you take your time, make sure you're safe, and this is William getting it wrong.
Ow! I'm coming!
A little bit later on, I'm going to show you the primary survey. I'm going to do that with Alex and William, and we'll show you practically how we assess somebody that we come across. However, when we approach somebody and they're talking to us, it can be a little bit daunting sometimes. We're not trained doctors. We don't have the level of experience, the qualifications that those guys have. But it's really important that we can quickly find out what's happening and if it is serious and whether we need to do something else. So it's called the sample questioning, from the word sample, okay? So what we're going to have a look at is we're going to have a look at their history, signs and symptoms. So the S of the sample question is signs and symptoms. So a sign is something that I can see. So that might be their colour, it might be their behaviour, it might be that their arm's pointing in the wrong direction, it could be that there's blood spurting everywhere. A sign is something that I can see. A symptom, so when you go to the doctors, he can't tell, he or she can't tell what's wrong with you normally just by looking at you. So they ask you your symptoms. So a symptom is something that you tell them. So it might be that I've had bellyache for a week. There's no way the doctor could tell that, but the doctor will say, what are your symptoms? And I'll say, I've had bellyache. So what we're going to do is we're going to look at what we can see, and then we're going to ask them how they feel. So they're your signs and symptoms. The A of the sample question is allergies. Are they allergic to anything? Really important information to get. In case we have to hand this information over to the medical professionals, are they allergic to anything? Because it could change their treatment when they get to hospital or when the ambulance arrives as well. So M is medication. Are they on any medication? And also, let's follow it up with some secondary questioning. Have they taken it today? It could be that they do take medication, but they've just forgotten to take it. They're at camp, they've got up, they've not followed their normal routine. So it's important that they do take their medication. So M, medication. So P, past medical history. Do they have any medical history that would give me any concern? It could give me a real clue on what's going on. And to be honest, if you're dealing with somebody who's gone grey, pale, cold and clammy, and you ask if they've got any past medical conditions, and they tell you that they had a heart attack 4 weeks ago, we're going to get straight onto 999. So it could give you a really big clue that there's something wrong. So that's the M. So we're going to have a look at the L. So that is last food and drink. Okay. So I don't know about you guys, but definitely when I've not eaten, I get hangry. My behaviour changes. I can get a little bit grumpy. And it can change things as well. So we want to know when they last ate or drink. And again, that information might be really important to give to the medical professionals as well. So find out when they last ate and drank. We deal with, which we're going to look at later, we're going to deal with heat exhaustion and heat stroke. How much water they've drank. If you're out on a hot day, you're out at camp, it'd be one of the first questions I want to know is how much water have you drank today? It could be as simple as dehydration that we can get them sorted pretty quickly. And then E of the sample question is one of the most important ones. It's the event. What's been happening? That one could give you a really big clue, because if you approach somebody and they are gasping for breath and they've changed colour, they've gone flush and they're clammy and they look really distressed. Now, without knowing what they've been doing, it's impossible to assess whether that's a medical problem or whether it's normal. If we ask them, what have you been doing? And they turn around and say, we've just been on a 2-mile run. Brilliant. Okay, that's normal for that situation. So we're going to sit them down, get them a glass of water, and hopefully those signs and symptoms will disappear. Now, if that person just turns around to you and says, I've just been sitting over on the bench there for the last hour reading a book, it's instantly going to alarm me, and I'm going to want to know more, and we're going to have to seek medical attention that bit. So that's how I assess somebody, and I really do use that. So we look at their history, signs and symptoms, and we apply the sample questioning, and you should be able to get to the point where you can say this is normal or it's not normal. If it's not normal, we pass them on to somebody else. It's really as simple as that. So what we're going to have a look at now is the primary survey. So this is how we approach a patient safely and how we make sure that we check them over correctly so that we know how serious the incident is. It's really simple. We use a mnemonic called Dr. ABC. So D-R-A-B-C. And when I do this, I actually say it out loud so that I know that I'm not missing anything as we go along. It's a really, really easy way to remember how to check somebody over in the first instance. And we do this, a lot of people when they've had training, they do this just for people that are unconscious on the floor, but we would do it in every single situation. So whenever we approach somebody, always apply your Dr. ABC. So we've got Alex to be our victim today, so I'm going to get Alex to come and lay down. Now we're going to apply our Dr. ABC here. So D, danger, we're going to have a look for first. So as I approach the scene, have a good look round. It might not be the most obvious thing in the scene. Sometimes we get really kind of tunnel vision where we look at the person and you forget to see everything around you. So have a good look. Have a look on the floor, have a look up in the air. There might be falling, debris, there could be anything. So have a really good look round. If it is dangerous, either don't approach the scene until we can make it safe or try and remove the danger. Okay? The best way to deal with it is to actually remove the danger from the scene. Now, if it was a case where William or Alex were in a dangerous situation where I couldn't remove the danger, but I could remove them, that would be my last option. Okay, we try not to move the patient unless it's life-threatening. So we've checked for danger. We're all safe now. Yeah, all good. So we're going to check for a response. So how do we think, boys, we would check to see if Alex was awake? If his eyes were closed.
Shout and shake.
Shout and shake, absolutely. So first of all, before I even get to Alex, I'm going to shout at him. Alex, open your eyes for me. Alex, wake up. It's much better to give them an instruction than just saying, are you okay? Because if they're in low levels of consciousness, they might not do what you need them to do. They might not show any response. Their brain will just be sitting there thinking, yeah, I am okay. So easiest thing for the body to do is to open your eyes. So Alex, open your eyes, wake up. Now, we're going to do the Dr. ABC as if there wasn't COVID-19 out there, and I will show you afterwards the adaptations that we'll make for it. So I want to train you so that when we hopefully get back to reality and get back to normality, you are going to be, you're going to be okay. So you'll know how to do both versions. So at this point, we're going to try and get a response from Alex. I've shouted at him from a distance, nothing's happening. I'm going to try and scare him a little bit. I'm still going to shout at him. Alex, wake up for me! Come on, Alex, wake up! Okay, that's, if they're in low levels of consciousness, we might get a flinch, we might get a shake. Do you think you would wake up at that point if somebody shouted in your ear? Absolutely. And now we're going to go, we've not had a response from their voice, from giving them a vocal prompt.
Shake.
We're going to gently shake their shoulders, okay? So we're gently going to shake them, okay? And that should, again, get a response if we're going to get there. We might just get a flickering of the eyes, we might just get sudden movement or groans, but that is showing you a response. Now, if we've not had a response at this point, we want to shout for help. This is, again, where we're going to shout as loud as we can. We want as many people on the scene as possible at this point. Exactly, so help, help, help. You want to try and get as much help. And if somebody doesn't come, keep shouting, okay? It's really important. Sometimes we do a tick box, we go, yeah, I've shouted, and no one comes. Keep shouting. It's a bit like a car alarm. If you hear it just for a couple of seconds, everyone ignores it. Somebody shouts for help. Unless they keep shouting, you'll ignore it. So we've now shouted for help. Hopefully we've got people on the way to give us a hand. You'll never know who you'll get when you shout for help. So we've done danger and we've done response. So we've done our doctor. Okay, so doctor. So now we're going to go for their airway. Now the airway is a tube that goes from their nose and their mouth and it goes into their lungs. I will show you in just a second a model of the airway and we'll show you exactly how that works on the human body. So the airway, as we've just mentioned in the video, is the tubes that go from the nose down into the mouth and down into the lungs. It's how we take air into the body. So here's a model. This would be the same as Alex just lying on the floor there. And as you can see, when they're flat on their back, sometimes this big white thing here, which is their tongue, it's a muscle, so it becomes all floppy. So what it can do is it can rest on the back of the throat and block the airway, so the air can't go in through the nose or the mouth down into the lungs. And so what we're doing by checking the airway and making sure it's clear is making sure that they can breathe here. So what we're going to do, and we'll show you this with Alex in just a second, is we're going to tip the head back, okay? So just by lifting the chin up, okay, and we'll show you how to do this on Alex, we're going to make sure that we're going to raise the tongue away from the back of the airway, so now the air can go straight into the lungs. It's a really, really important thing to do to make sure that, if possible, they can breathe. The other thing that might be, anything else that might be a problem with their airway?
Like a grate might be stuck.
It might be blocked with an object. Absolutely, could be a grate, could be some food, could be a piece of Lego, could be anything as well. What else might be in there?
Vomit.
Vomit, yeah,
so
absolutely.
They'll vomit up and it'll come straight back.
Well, a lot of the time, because when they're unresponsive, they don't vomit like we vomit when we're sick. They just literally, their stomach opens and it floats, it kind of drains into the back of their throat. So all I'm going to do with Alex, just to make sure that there's nothing in his airway to start with, I'm just going to put my hand on top of his head and I'm going to open his mouth and I'm going to have a quick look in there. If there is anything in there, what we're not going to do is I'm not going to put my finger into Alex's mouth. There's a good chance he might bite it if he's in low levels of consciousness. Or I wouldn't dare put my fingers into your mouth, Alex. But the other thing that we might do is we actually might just press it down further into the throat. So if there is anything in there, what I'm going to do is I'm just going to very quickly just get Alex over and just roll him over and just let that all drain out, okay? And so that will just free the objects or the vomit as well. It will help. So we'll just get him over and let that drain. You are okay once he's on his side, just to use what we call like a finger sweep, just to try and get that out, just to help it on its way. No pressing fingers into their mouth. So the other thing now, so we've made sure that the airway, there's no objects or there's no vomit in there. What I need to do is I just need to make sure that the tongue is a problem. Absolutely. So what we're going to do is I'm just going to put my hand on top of their head and 2 fingers underneath his chin, and I'm just going to rock his head back, okay? So that now will take the tongue away from the back of the throat. Okay, that will clear that as well. So we've got the airway clear now, okay? So we've done danger response or doctor, and we've done our airway check now, okay? So breathing, absolutely. That's the biggest question in everyone's head. And this is why we use Dr. ABC, because it's quite often the airway bit, because the biggest question in our head is what, William? What do we want to know?
Are they alive?
Are they alive? So we go straight in to check for breathing. But I might go down and do the breathing check, like that, and it might be that there's nothing wrong with Alex's heart, nothing wrong with his lungs, but it might be that the airway is the problem. So we can't check properly unless we've done the airway set. So what we need to do as well is when we check for breathing, I need to keep Alex's airway open. Because if I do this, and then go and check it, the tongue could just flop straight back onto the throat.
And then you won't have breath.
Then you won't be able to check it, yeah. So we might start CPR unnecessarily on Alex if he needs that. So what we're going to do is just keep his airway open, and I'm just going to put my ear next to his mouth, and I'm going to hopefully feel him breathing. I should hear it as well. And the reason I'm looking down his chest is so that I can see his chest rising and falling as well. So we do those, look, listen and feel to see if he's breathing. Now, how long do you think I should check breathing before I decide whether it's happening or not? Actually, we don't need it. If you put your hand in front of your mouth, and you can do this at home, put your hand in front of your nose and your mouth. How long? Really quickly, don't you? Yeah, absolutely. We're going to give them 10 seconds to check how long they're breathing. And in those 10 seconds, we should expect to see, feel and hear 2 normal, quiet, rhythmical breaths. Okay? And it should be like you're breathing now. Now, in...
What do we do if you don't feel them or hear them breathing?
We're going to come on to that. That's a really good question. Yeah, I'll talk to you about what happens when we do breathing when we don't
And then it's a C.
We're going to move on to C in a minute. But what I want to talk to you about is, in quite a lot of cases, when we check for breathing, when people die, people expect them to be still, quiet, and totally like Alex at the moment. However, that's not always the case. The reason I say that you want to check for a minimum of 2 normal, quiet, rhythmical breaths is that when people stop breathing sometimes, we get this noise, and it's called agonal breathing. Now, if you walked up to somebody and they were doing this, what do you think?
They're asleep.
They're asleep, yeah, absolutely. But they're not asleep because we've shaken them and shouted at them, so they're not snoring. And you might get movement as well. So you might see almost like seizure-like movements in their hands, or you might see their arms moving. Now, what's happening is the person has stopped breathing and their heart has stopped. However, their brain, for a few minutes afterwards, is still going to function. So you might get this kind of gasping, snoring sound, but you might also get some movement as well. But what we're going to go on is, I want to hear 2 normal, quiet breaths. And if I don't get that, we're going to move on to CPR. Okay?
Or can't see me CPR and cool.
It means, yeah, the C, traditionally when we train first aid, it means circulation. Now, circulation really doesn't mean a lot for us as first aiders. I'm not going to check a pulse on Alex because it's too difficult for us to do unless we do it on a regular basis. It would mean that if Alex is breathing, okay, what it would mean that I would check for bleeding, because that's my next priority, so that's your circulation. However, in this case, if Alex isn't breathing, the first C is I'm going to call the ambulance, okay? Why do you think I would call an ambulance at this point, after I've checked for breathing?
Because if they are breathing, it's a waste of time for the ambulance where they could actually be going somewhere where they're saving someone's life. Like the person you're treating isn't dying, you know, they're perfectly fine. Well, not fine, but they're still alive.
Yep.
And you can treat them.
Yeah.
But then, yeah, that's why I wouldn't call it, because it's just a waste of time.
Well, do you know what the first question is that you get when you get through to the ambulance control room? Do you know what the first question you get asked is?
What? Are they breathing?
Are they breathing? So if you haven't done that bit, they're going to send you straight back and you'll have to check anyway. So we always go danger response, airway, breathing, and then if they're not breathing, or even if they are breathing, we would call for help, call 999. Because if Alex is unconscious, I'm calling an ambulance straight away. Anyway. Or 112. Awesome knowledge, Alex. Good job. So the C can mean various things. For me, it always means call the ambulance. It means start CPR. And also, if they are breathing, we're going to check for circulation problems. Bleeding is my next priority over breathing. So, so that is our danger response airway breathing. So if Alex is breathing, we call the ambulance and we put him in the recovery position, which we've already done. And if he's not breathing, we would commence CPR at that point as well. Does that make sense?
Yes.
So I'm going to get William now, and if you guys want to do this at home, I want you to do Dr. ABC.
Okay, so check for danger.
Good job. So D, yeah.
And then
So R for response.
Response, yes.
Yeah. Shout.
Alex! Wake up! Open your eyes!
Okay. And then get right close to him and shout at him.
Wake up! Open your eyes!
Okay, he's not responding to that. And he's probably deaf now, so gentle shake. Alright, so he's not responding now. Yeah. So,
Okay, so
danger response A.
Airway.
Okay, so have a quick look in his mouth.
yeah.
Okay.
Yeah.
There's nothing in there, so tip his airway all the way back. Okay, 2 fingers just underneath his chin. That's it, rock it back. And now straight on to B.
Breathing.
Okay, so keep his airway open. And how long are you going to check for?
10 seconds.
Alex, stop licking his ear. And how many breaths do you want to hear?
2.
2 normal quiet breaths. Awesome. Is he breathing?
No.
No, he is. So, fantastic. Brilliant. So that is our primary response. Now, we would, as I mentioned, you would do that straight away. If you walk up to somebody and they're sitting in a chair and they're bleeding, you would always do your danger response airway breathing, just your AB, Dr. ABC. So we're going to walk up, make sure you check for danger. You will check for response. You'll say, are you okay? My name's Paul, can I help you? And that, if they answer you, tick, we've got a response. If they're talking to you, they've got an airway. If they're talking to you, they're breathing. And then we might move on. Circulation will be the problem with the cut. So always use it. Don't just use this when somebody's lying on the floor. Great, so that's your primary assessment. Very important part of first aid, so well done. Now, with COVID around, the virus, we're going to have a very quick look at that. Now, we're going to change it a little bit. We're going to put danger, okay? So we've got danger. Alex, stay where you are. That's okay. You're doing a great job. So, danger. We will do that the same as always. We're going to have a look at that. With a response, all we're going to do here is we're going to do the shouting from a distance, okay? I'm going to keep my distance from the patient and just shout. Now, the airway, we're not going to do an airway check at the moment because of COVID, because that's the bit I don't want to go anywhere near. We don't want any of the air droplets to be anywhere near me. Obviously, if you've got PPE, this is a great idea to be wearing this.
So basically with COVID, when COVID's around, it's basically Dr. BC.
Yeah, well, what we're going to do is, I'm going to change it slightly. So, danger, response, assess for breathing, okay? And how we're going to assess for breathing is different. We're going to look from a distance. We are going to look to see if that patient's breathing, and that is going to be my judgment call on breathing at this point. And then we'll move straight on to the C again, which will either be call for help.
CPR, you can't do CPR.
We can do CPR. Now,
you can't do the breath.
No, we're not going to do the breaths because we've not got the right equipment. But at this point, what we're going to do is I'm going to put... do you want to just take the coat off Annie there for me, William?
The coat.
Yeah. I'm just going to show everybody a couple of ways that we can just make sure that when we're doing CPR, we are going to keep ourselves as safe as possible. So we could just use a piece of clothing, a towel or anything like that, and it would just be over Alex's face while I was doing CPR. Or another one that everybody's got is I'm going to put that up, and then that will go over the head, and then we can do CPR at that point and just keep that nice and safe. So again, we are making a few adaptations for COVID at the moment. So that's, just remember that. So danger, response, then we assess for breathing, and then we'll move on to the call for help, and then circulation as well. So they're just the adaptations that we're having to make at the moment. Hopefully not for too long. Okay, so we'll move on to the next section now. Okay, so now we've completed our primary survey. And in this case, they're unconscious, so we need help. Now, as a first aider, we should always shout for help. You never know who you're going to get, okay? You might shout, and an off-duty paramedic or a policewoman or a fire person or somebody from the military might be around to help you. So you just shout for help. You never know who you're going to get. Always try and deal with it. Obviously, as children, young adults, we want to be trying to get a leader, get a grown-up on the scene as well. They may have had more training than we have, and if there is somebody with more training, brilliant. Okay, to be honest, I'm always really happy when somebody turns up who's more qualified than I am. So shout for help. Now, if we get bystanders, even if they're not first aid trained, they can still help us. They still might be able to control the crowd. They might be able to phone for help. They might be able to get equipment for us, blankets, water. They can be a real help as well. Sometimes they can be a bit of a hindrance for us as well. You might get somebody who's being quite annoying, trying to film you as well. Quite common these days that if somebody's had an accident, the first thing that some of the bystanders will do is get their phone out. Now, the best way, instead of shouting at them, instead of getting angry, is to use them, okay? We're going to give them jobs. Now, important jobs that they might be able to do, the person who's got the phone out, he's just shown you he's got a phone. So we're going to ask him to call for an ambulance. Now, if somebody, again, is getting too close to you or being really annoying, one of the great jobs that we can send them off to be is what we call a windmill waiver. So that might be that we need somebody to go and wait for the ambulance. So say if we're at camp, that might be quite difficult for the ambulance to find us. So we'll get them to go and wait at the camp entrance, or it might be outside the scout hut. But again, it's a good way of getting rid of somebody if they are being a bit annoying. We call them windmill waivers. We want them doing this outside waiting for the ambulance. And it is a really important job because the sooner we get the ambulance to the patient, the better. So loads and loads of jobs that just bystanders can do for you. When you have a go at CPR in a minute, you'll figure out how tiring it is. And if we're on our own, even though we've had some training, we might know more than the bystanders. The bystanders can get involved and they can help us. So all it is with CPR is a physical pushing of the chest, and you're going to get really tired. So even a bystander with no training can help in that situation. We can also get them to go and get a defibrillator as well. So we'll look at how we can get a defibrillator a little bit later on as well. So hopefully we won't need this, but there might be times that you need to call the emergency services. So we have in this country a couple of numbers that are really useful for you. So the traditional one is 999. So that will go through and you'll get through to the operator, and the operator will ask you which service you require. Now, I'm not going to spend a lot of time going through what you need to do at this stage, because the great news is that as soon as we go through and we say ambulance, we're going to be put through to the operational control centre, and they are so well trained. They're going to help you through everything. So even if you forget some of your first aid, they're going to tell you what to do. So we covered the sample questions earlier on. If you've got that information to hand, all well and good, but they are going to run through that with you, and they'll get the information that they need to help determine how quickly you need that ambulance as well. So it's really important that we do have that information as well. Just bear in mind as well, with getting the information from the sample questions, that we get it because the patient may become unconscious and then we've lost any chance of getting that information. So as soon as we call through on 999, we're going to get there. Now, there is another number to use, 112, okay? The great news about this is it works brilliantly on mobile phones, and it also works always across Europe as well. So if you're on an international camp, if you're in Europe, just call 112 and you'll get put through to the local services who will be able to help you there as well. So, yeah, your mobile phones, really, really important points here. Now, we're going to have a look at mobile phones. Most people carry them. But it might be that you don't have one, or you're out of battery or out of signal. So you might need to access somebody else's phone. Now, how we do this is we either swipe on the screen or press the home button, and you'll get through on the mobile phone to a bit where it says emergency. So as soon as you press the emergency button, you'll go through to a keypad, and that will enable you to dial 112 or 999. So you can easily use a mobile phone that's locked as well. So as soon as we've got any communication, that's really, really, it's fantastic that we can get a hold of the emergency services quite easily. Now, mobile phones, they are fantastic. I love them. I love technology. Now, there are a couple of apps out there that are really, really useful for us. Obviously, when we're out and about, location is an issue for us sometimes. So obviously we've got Apple Maps, we've got Google Maps, which can give you your exact location. There is a fantastic app now called What 3 Words. Now, What 3 Words has split the whole of the globe into 3-meter squares. Now, when we press on What 3 Words app, what it will do is it will GPS locate where you are, and it will put your location in 3 words. So it may be that we're in tent, tissue, biscuit, and we give that to the emergency services, and they will know exactly which 3-meter square we are in any given location. So it's a really, really fantastic app, and it's a free app. I would certainly download that. Now, another good one as well is the Ordnance Survey map, the Ordnance Survey app as well, again, because that can give you very, very specific location of where you are. Now, there are some really good first aid apps. Have a look out there. There's loads and loads of them. Just be really careful with what you read on the internet. I hear on a lot of the courses a lot of fake news. A lot of people that have read things on the internet, and a lot of it's incorrect. So if I need to back anything up, I will always go to the Resuscitation Council website. That's where we get all of our information about CPR and serious events, and also the NHS as well. It's always worth having a look on there on what the advice is, because we know that that's government approved as well. So be careful what you read on the internet. But again, mobile phones, technology, it's got a massive part to play in first aid. So make sure you get help and you use everything available with the resources that you've got. So now we've done our initial survey, our primary survey, and we've got help on the way. So we're going to have a look now. If somebody's breathing but they're unresponsive, what we do there, we put them in the recovery position. So we're going to have a look at a couple of ways of doing that. I've got a question for you boys. If somebody won't wake up and we can see that they're breathing, do we put them on their back? Do we put them on their side? Do we put them on their front? Or do we put them on their head?
On their side.
On their side, yeah. Why would we put them on their side? Good, I like the buzzer coming in there. Yeah?
Because probably in a better place for them, maybe?
Yeah, it is, yeah. It keeps them safer. So it just means that it makes their breathing a bit easier. And if they do something when they're asleep, when we can't wake them up, if they're sick, then the sick comes out of their mouth and it keeps them safe. So what we're going to do now is Alex is going to show us how to put somebody in this position. And so watch it this time, and then I'm going to get William to put Alex in the recovery position. And whilst he's doing that, you can have a go with your friend, your sibling, your grown-up at home, and get that sorted. So actually, your friend shouldn't be with you at the moment. That's a very good point. Right, so Alex is going to move the nearest arm to him out of the way, and then he's going to lift up the furthest knee. And he's going to keep his hand on that knee, because if William wasn't pretending, it would flop over to the side. And grab hold of that hand and put it down by the side of his head, Alex. And now we're going to pull, keep hold of his arm there, because otherwise it will flop, and then roll him over with this knee. And now this is really, really useful, because if it's a grown-up that you're having to do this on, by pulling on that knee, it means that you can roll somebody much bigger than you over. So it really, really helps. So Alex has just got his knee out of the way, and he's got it into a 90-degree angle. What do we need to do with this chin, Alex? There we go. So if you just come and kneel behind William now, so everybody can see. So William's on his side and his mouth's open, so he can breathe really easily. And he's all nice and supported now. He's not going to move anywhere, which we call this the recovery position. So if whilst you're waiting for the ambulance, if they're breathing, we're going to... And
it's kind of the most important position in first aid.
It is, yes, really important. We practice this one a lot, don't we?
Because doctors can easily get them out of us and they'll really help them.
Yeah, exactly. So if you two swap round, and I want you guys at home now to have a practice with this. Okay, so make sure that you're practicing. This is a really good one for us all to practice on a regular basis. So you have a go at home now, and then William's going to put Alex into the recovery position as well. Good job. So the nearest hand comes out, and the furthest leg goes up, and then grab his hand next to his head, and then roll in with his knee.
Wait.
That's it, just pull on his knee and he'll roll over there.
Okay, and then this comes out.
Fantastic. So again, we can see how easy it is. Now, we do this at Cubs and Beavers, and we've seen really small children roll in quite big leaders, and I remember doing this at one of our local schools at St Edward's First School, and the children were moving quite big adults in this, so it really, really works. So have we got a giggler there?
Yeah, we have.
Yeah.
Ow!
So is that comfy on the floor there, Alexi?
No, I was doing like drawing on the back.
You're drawing on your back. Okay. Right, so what we're going to look at now is the recovery position, but just a different version of it. So in the live shows, we showed people how to do the recovery position when somebody was lying on their back. But you know, when we get to somebody, we don't determine the position that they're in. We have to deal with how we find them. So it might actually be that they're on their front. They've either passed out or they've been knocked out, and they're lying flat on their face. Now, actually, for the draining of vomit and the tongue being an issue, it's not so much of a problem for us. But what happens is when they're lying on their front, all their weight is going through their chest. So if William just comes in and lies just on the rug there, so if you lie flat on your front there, so William now has actually got a lot of weight going through his chest, and that's going to make it quite difficult for him to breathe. And a lot of people actually, when we say do you sleep on your back or your front, a lot of people say that they sleep on their front. Boys, where do you sleep? Do you sleep on your back or your front?
Side, like this. I sleep
So what William's doing, and this is why we sleep in this kind of position, we tend to put ourselves in a safer, easier position to breathe. So if William goes down on his front, that's it, a bit like that. So all I'm going to do is I'm going to have a look at which way William's nose is facing. Just hold on a second, Alex. Okay, William, if you just face your nose to the camera. Okay, so I'm going to do it as if I was on this side where the camera is, just to make it easy. But I figured out that William's nose is pointing that direction. So what I'm going to do is I'm just going to move this hand into this position here, into our how position. Keep this arm just down by the side. That's all okay there. And this is the real trick. We're going to move the knee to the nose, the nearest knee on the same side of the nose. We're going to move it up, and this will give him his sleeping position. Okay, so all we're going to do is move him up into that 90-degree angle. William's he's not very flexible, are you, William? So the only disadvantage about doing this with short stuff. So as you can see now, what I've done is I've actually raised William's chest up, and we're supporting him with this leg. William, okay.
Take some time.
Okay, so he's now actually in a safer position. So if he vomits now, I know that that's going to come up. We're just going to open his airway up, and that'll make it nice and easy for him to breathe. So actually, when they're on their front, it is a lot easier for us to deal with. So the recovery position, either on the back or on their front, we can deal with that with no problem at all. Really quite easy. Okay, nice and straightforward. So that's the recovery position. So that's what we do when we find somebody and they're unresponsive, but they are breathing. So we're going to have a look now at what happens when you do your primary survey and they're not breathing. So to keep somebody alive that we find that isn't breathing, we've got 4 things to do. And we call this the chain of survival. We need all 4 parts of the chain if we're going to give them the optimal chance of survival. So the first part of the chain is call for help. We've got to get the emergency services on the way straight away. The first question that you get asked when you ring the emergency services is, are they breathing? So that's why we do our primary survey right up to the breathing check, and then we call for help. We need to get them. Now, let's put ourselves in a really bad situation. If we are out on a hike and we're in the middle of nowhere and your friend collapses and you check them and they're not breathing, you go for your phone and the phone's out of battery. Your friend hasn't got a phone. Now, we've got to decide what to do. A lot of people in this case, because they've had some first aid training, want to start CPR. They know that CPR is the thing that is keeping them alive. But in this case, it's not the right thing to do. We have to raise the alarm, okay? We have to go and get help at this point. So just put them in the recovery position and run as quickly as you can. Now, there are a couple of times where this isn't the case. So if it's a child, so if they are under puberty, we are going to do 1 minute's worth of CPR and then go and get help. Same as if somebody's drowned as well, we would give them 1 minute of CPR and then go and get help. It's just due to the way that they've stopped breathing. So we're expecting an adult for it to be their heart that is the problem. And believe it or not, they've still got quite a lot of oxygen in their system. So we're going to rely on that to keep them going until we go and get help. Now, if it's a child or if somebody's drowned, it's normally that their lungs have stopped first and then their heart keeps beating and it uses all of the oxygen. So what we do there is we give them a minute of CPR just to top them up, starting with 5 breaths first. Okay? So that's our first part of the chain. Get help as quickly as you can. The second part of the chain is good early CPR. So CPR keeps them alive. All we're doing is the heart is a big squishy bag of blood. We're squeezing the blood around the body to feed oxygen to the brain. Really, really important, keeps the brain alive, and then that enables the next part of the stage, which is chain link 3, and that's early defibrillation. So what we want there is a defibrillator to whack the heart back into a normal rhythm, hopefully, and that will get them to survive. Now, obviously, that we don't have defibrillators all the time, but it is a really, really helpful part in the chain. It really improves their chance of survival by quite a lot. The fourth part of the chain is the emergency services. We want them on the scene as quickly as possible. So the chain 1 and chain 4, obviously, a really important link there. So that's our chain of survival. That is how we keep people alive. We are now going to move on and have a look at CPR, and we'll show you how to do that. We are going to make mannequins. You can use cushions, you can use teddies. We thought you being scouts, you want to be a bit more grown up, so we'll show you how to make a CPR mannequin. The bits of kit that you'll need for this section is a t-shirt, a coat or some jumpers just to stuff the t-shirt, a 2 litre plastic milk bottle with a top on it, or a 2 litre like Coke bottle or something like that, an elastic band, and a balloon, and a marker pen if you want it to look real. So get that kit together, pause the video, and then we're going to show you how to make your CPR mannequin and show you how to do CPR as well. So what we're going to have a look at now is we're going to have a look at CPR. Now in the live shows that we did for the younger children, the beavers and the cubs, we made mannequins out of their teddies. And that's okay to totally do that if you want to, no problem whatsoever. Another thing we can use is just a pillow. We could use one of those.
Or a mannequin.
A mannequin, yeah, as William said. So when I do my training, I've got loads of equipment. We always use the top end. These have got electronic sensors in them to tell me how they're doing them.
And for shots, is it like?
Oh yeah, for using the defib. Yeah. So we use the dolls for this. Now I'm presuming at home that you don't have a mannequin unless your parents are first aid instructors. So we don't have these generally. So what we're going to do is we're going to make one. You can just use a pillow, you can use teddy. We're going to try and make it just a little bit more realistic for you so that when we do our CPR practice in a minute, you can actually do this as well as we can. Obviously, we're just going to rush through this quite quickly. Stop the video, get the bits that you need, and then you can follow along, and then you'll have your own CPR mannequin. It's a really good idea, and to be honest, if with your scout leaders, you don't have the equipment that you need for the first aid training, it's something that you can just make, and it works just as well. They're really, really effective. So, William, if you want to start passing me some of the kit, you're going to need a t-shirt, you're going to need a couple of coats, so we'll just do a couple here for me. Okay, William, thank you. So if you grab your t-shirt over there. And then what we're going to use inside the doll to kind of give us a bit of pressure when we're doing CPR is, this is just a 2 litre empty milk bottle. These are really good. When they've got the lid on, they'll actually give us a bit of pressure there. An elastic band as well. A marker pen. And because we're going to make our doll quite realistic, well, as realistic as it gets, we're going to use a balloon as the head. Alright? So, if we grab a balloon. Can you look after the balloon for me, Alex? Because Alex is going to help me with this one. And William's going to follow along with this one here. So, what we need you to do is just get hold of your t-shirt.
And stuff.
There we go. And we're going to stuff the 2 coats inside it. Alex, if you want to have a go there. Let's get that inside.
Fat boy.
But we want the t-shirts to be relatively firm because we're going to be pressing on it.
Wait, are we making an adult or a little?
So I've used adult t-shirts. So you could use children's t-shirts, and obviously it's just appropriate for the size there. So we've got our body. Okay. So what we're going to do now is we're going to just wait for William. Okay. Right. So William now has got his t-shirt stuffed in. So we're going to get our milk bottle, and that's going to go into the centre of the chest. Okay, it should just make a bit of a pocket there. Now what we're going to do, have you been looking after our balloon there, Alex? So we've got the bit that we're going to push in the centre of the chest there. Now, what we're going to do is, I've got William, I've got an elastic band there. So, yeah, you can draw the picture. Alex is going to draw a face on there. So I'm just going to get where the ring is on the milk bottle. I'm just going to get an elastic band and I'm just going to tie that onto the handle and leave that pointing out because I'm going to connect the balloon to the bottle and it will just stop the bottle riding up and it will stop the head flying off as well. Okay, so do you want to do that then, William? If you connect the, so if you can tie the elastic band to the loop in the milk bottle, so that's quite easy to do. That's it, use the big one, that's it, so thread that through and then pull it through the loop there and you see how that ties on? Let go of that one. There you go, like that. Yeah, have you finished with your face? Oh, what a cool face. Do you want to go and show the camera that one, Alex? Well, there we go, we've got a fantastic face. Come on back. Okay, so I'm just going to tie the face or the head onto the body now. So I'll turn it round for you, Alex, don't worry. Just out of the camera there. Good lad. And then I'm just going to tie that on with an overhand knot. You going to tie that on, William?
Yeah, once I've done my face.
Okay, come and sit down, Alex. Right, okay, so as you can see now, we've got our mannequin there.
It needs to be a bit bigger, the face.
Okay, so we've got our mannequin with the milk bottle right in the centre of it. So, this is our CPR mannequin. In your head, haven't you? So, right, so we've got our two mannequins there, okay?
Yeah.
So, what we're going to do is we're just going to have a look at CPR now. Now, what we're doing when we do CPR is the heart is a big squishy bag of blood and we need to squeeze the blood out, let it refill and squeeze it back out again. So we're going to do our primary assessment, which we've already gone through. So we're going to do our DRABC, and then we're going to walk into CPR. Now, a few of you will have done this before, you'll have done first aid before, and you'll have been doing breaths. But because of COVID-19 at the moment, the breaths are out. Okay, so what we will do instead is we will get a piece of fabric or a towel or a piece of clothing and put this over their face so that when we're doing our compressions, they're not expelling any droplets that could cause us any problems. So that's just the modification that's been made through COVID-19. That's brilliant faces, boys. That's enough drawing there. Okay. So we'll have done our initial assessment, our primary assessment. We realised that the patient's not breathing, so we're going to get our phone out. So all of a sudden, I'm going to grab my phone. What numbers do we call, boys?
999 112.
Fantastic. So we've done that. If I'm on my own speakerphone, put that down and they'll talk you through this as we're going to do it. So, where do I push in their chest, boys?
Then we push it like around here.
Yeah, so right in the centre of their chest.
Put it on like the heart.
Okay, right in the centre, okay? Now what we're going to do is, the position that we put is we're going to interlock our fingers like that, and the bit that we push down within the centre of the chest is the heel of the hand. And we're going to push down about a third of the depth of the body. We always say a third rather than sizes because everybody differs in size. So we could do this even with a child. We make it the force appropriate for the size of the person. So no, it's okay. Don't worry.
You do it like that if it's a baby.
Exactly. So with a baby, we'd just use a couple of
Do it
fingers.
on like just a normal a children's.
Yeah, if I was doing this on you, because I only need to squeeze down a third of the depth of the body, I would only use one hand. But I think with the size of William, I'd probably have to use two hands, okay? Alright, so what we're going to do is we're going to put them in there. I'm going to let Alex have a go on the one that he's made. And if you can just grab Annie for me, if William you just spread out a little bit. Okay, so what we're going to do is, as I say, with the new regulations, we're just going to cover the face so that no droplets come out. And we're going to push right in the centre of the chest. make sure that you lock your elbows and you get your shoulders right over it as well. We want all the weight of the shoulders coming down, and we're going to push down about a third of the depth of the body. Now, Alex and Williams instantly went for a song. What song did you
Baby shark.
Most annoying song in the world. But we like singing.
When I went to the town, a lady was singing it.
Fantastic. And it's the rhythm that we're interested in. It's between 100 and 120 beats per minute. So we're going to do that. Boys, are you going to sing Baby Shark? If you don't like Baby Shark, if you go to Spotify, there is a whole playlist of songs that you can choose. The one that we traditionally use in CPR is Staying Alive. I'm not sure you guys will know that, but have a look on CPR playlist on Spotify.
Right,
So,
my hands won't get it.
They will. That's it, exactly
No,
that.
it's the other way.
It doesn't matter. I use it that way, but whichever way is more comfortable. You can even do that as well. Okay, so put the heel of the hand right in the centre of the chest, right between the nipples on the dome, and we're going to do 30 compressions. Now, because we're not doing the breaths, traditionally we would do 30 compressions, 2 breaths, 30 compressions, 2 breaths. We're not doing that now, so we are just going to carry on. And how we would do that, we don't need to count to 30, we just do count to 4, okay? You ready, boys?
Yeah.
Okay. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Don't bounce, Alex. Keep your hand on the dog.
Baby shark.
2, 3, 4. Let the chest come all the way up. William, press on that bottom.
Yeah.
1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Okay, good boys. Okay, so try and keep this in place. Okay. Right, so we're just going to continue to do CPR until.
Basically, we kind of need to start.
Yeah, absolutely. That's the bit that makes the doll in there. So you just pull their head off, yeah? so boys, when do you think you would stop CPR?
When they start breathing.
Yeah, so if they tell you to get off, absolutely. If they start breathing and they wake up,
get off, get off!
and we can see signs of breathing, we're going to just stop what we're doing, put them in the recovery position, and again, wait for the paramedics to come as well. Any other times that we would stop doing CPR?
If they die.
Well, the good news about that for us as first aiders, it's a really good question, though, a good point, is that we never get to decide when somebody is dead. So we just keep going until either the patient tells us to stop, or the paramedics or somebody more senior to us tells us to stop. Either we're too tired, because you can't do this indefinitely, so you just keep going until you just can't physically do it anymore. Or if it's too dangerous, it might be that we are in an outdoor situation, and the situation changes to a point where we don't feel comfortable or we don't feel safe, that we can continue doing CPR. So they're the only time. But you never ever get to decide that the patient is dead, which is, I think it's quite good. We just keep going as best we can. Do the best we can.
If they do die, you will just still be going
Well, the good news for us is we're not doctors, so we can't make that decision. It's medical staff that actually do that. But it's a really good point. It's one that people always think about quite a lot. Okay, so that's how you make your own CPR doll and you have a go at CPR. So make sure you do your initial primary assessment and then something over their face, and then we're going to start pushing just 1, 2, 3, 4, 1, 2, 3, 4. It's quick. It's about between 100 and 120 beats per minute. Baby Shark is a good song that's loads on Spotify as well. So I just wanted to have a quick look at mouth to mouth. As we mentioned in the CPR bits that I did with the boys, the advice at the moment with COVID is that we're not doing that. We're going to do what's called a dynamic risk assessment and have a look to see if we're safe, if we've got appropriate equipment. But generally, at the moment, we're being advised by the Resuscitation Council not to do mouth to mouth. Now, obviously, we can put a towel or something over their face. One of the easiest things is just to get their shirt or their top and just put it up and put it over their face and their nose. I am going to show you how to do the breaths. Just because hopefully this won't be around forever, and I want you to know what to do if we get the advice to go back to doing mouth to mouth. So there's 3 things you have to remember with doing mouth to mouth. The first of all is that we've got to open the airway. The tongue can be really floppy, blocks the back of the airway. So what we're going to do is we need to have the airway open, and we do that by tipping the head back. So we can keep hand on top of the forehead to keep that open. Now, what I do is, because we've got to seal the nose as well, because if I put a breath into the mouth and I've not closed the nose, it's going to come out. So I use my hand to hold the head back and pinch the nose. So I've got a seal on that now. So the other seal that I need is to make a seal around the mouth. So I've got to get my mouth fully over that mouth. Now, if you don't get the breath in, it's highly likely it's one of those things. You've either not got the airway open, you've not pinched the nose, or we've not sealed the mouth. So traditionally, I would be doing 30 compressions. Okay, so we start with the compressions first. I'm a grown-up. Okay, we'll do 30 of those, and then we open the airway, pinch the nose, seal the mouth, and we put 2 breaths in. Okay, and we get a chest rise. I'm actually looking down the chest as I'm putting the breaths in, taking a fresh breath from the side as I do it, so that I'm not re-inhaling any air that's coming out of their lungs. And you've got 10 seconds between stopping the compressions, doing the breaths, and jumping straight back onto the compressions again. The compressions are the most important thing here. This is the bit that we're pumping the oxygen around the system. So we need to be on that one. Okay, so that's just how we do the breaths. If it doesn't go in, if you put a breath in and it doesn't go in, you don't see the chest rising, or it feels like it's not going in, don't redo them. You only get 2 goes at doing them. So if the first one doesn't go in, don't do number 3, number 4, number 5. 2 attempts and then get straight back onto the chest. There might be a blockage in there that you don't know, and so we need to get back on with the chest compressions at this point. Right, we're going to have a look at defibrillators now. So you might have noticed the boys have had a quick change. So why have we had a quick change, boys?
We went outside and had a water fight.
Yay! It's really hot today, so the boys went out, got absolutely soaking in the garden. So excuse the change of outfit. So we are going to have a look at defibrillators now. So what does a defibrillator do? Any idea?
Gives you an electric shock.
It does give you an electric shock.
Wasn't it kind of like it? So like if the heart's like this, it goes zap and it stays still.
Wow, good knowledge. Yeah. So most of the time when somebody stops breathing, their heart has stopped pumping. And what happens is everyone thinks that the heart stops, but it doesn't. It just normally goes into a funny rhythm. Yeah, absolutely.
Yeah.
So quite often it goes into a rhythm like this, where the heart is quivering. Okay, so believe it or not, what we use the electricity for, what we use the defibrillator for, is to shock it and to knock it out of that rhythm. So we use electricity, bang, and it stops the heart. Well, it actually stops it, turns it off. Everyone thinks that the defibrillator turns the heart on, but it actually turns it off. It stops it. Now,
then what if it doesn't come back on?
So,
if it just stops?
Here I've got a question for you now. If you're at school and you're using a computer or any electrical equipment and it goes wrong, what does your teacher tell you to do with it?
Turn it off and off?
Yeah, and that's what we're doing with the heart. It's exactly the same. So the heart's got an electrical problem. So what we do is we turn it off and then hopefully it reboots. It starts itself. If it doesn't start itself, which was your question, we keep going. We keep trying to shock it and keep trying to shock it. Absolutely.
What's these ones?
These are defibrillators that we've got. Well, they don't measure them in volts. They measure them in joules.
Can we do one?
Energy.
Can we actually do one?
We're gonna have a go. Yeah, absolutely.
Yes,
so the biggest thing to remember with the defibrillators is that they're really easy to use. They give verbal prompts, audio prompts that'll tell you what to do. There's also pictures on them as well, and normally words about who you can use them on, etc., etc. So they are idiot-proof. Okay, so we're going to have a look at a few different types of defibrillators today. So we've got the red one, this one here, which is actually my defibrillator. This is the real one. We've got this big bright lime green one there, and we've got this little yellow one here as well. So these two are training models which we use on the courses. So we'll show you these different types of defibrillators. Now a defib will always come with a bit of kit in it, because we're going to need a few bits apart from the defibrillator. So it's going to have a pair of scissors. Any idea what they're for, boys?
To cut the things out.
To cut the, yeah, exactly. So this person's got clothing on it, and I've got to stick the pads actually directly onto the skin. So a good pair of scissors. It will need. If we undo this and it's a lady, what is she going to be wearing underneath there?
Bra.
A bra, yeah. So we would need to cut through that as well. Okay, because the bra's actually got metal in it as well. So metal and electricity get on really, really well. So we would need to do that. So the scissors are for access. Obviously, Annie, we've got her coat on anyways. Yeah, so we've got a razor on there. So if this is a big hairy guy, then we're going to have to shave the hair, because the hair won't get to. It won't allow the pad to stick onto his chest. And that would be if they've been on a beach or something, they've got sand all over them. we need to wipe that down so that the pad can stick to the skin, because these pads are really, really sticky. We've also got in there as well, there'll be some gloves, almost like a micro towel, and this thing here is a pocket mask, and this will, if we're doing mouth-to-mouth in the future, then again we've got a pocket shield, which enables us to do that quite safely. Okay, so these are just a pocket shield to make mouth-to-mouth a bit safer so that we're not going to catch anything from the patient. So a bit of kit in there as well. So, also in there we've got our defibrillator itself, and we've got a set of pads. Now the pads will give you all the information about where to put the pads, and also the age group that we need to put this on. So William, which age group, if you read that, do you think we should be putting the pads on?
Anyone but babies.
Anyone but babies. And so William's never seen those pads before, but straight away he can read that it says it's okay for adults and for children. It's got ticks really clear on it as well, and pictures as well.
Man, child, adult, child, and a baby, and the notice under the baby.
Perfect. So really clear. So they're the bits of kit that we're going to get in the defibrillator as well. So that's my real one. We'll put that one out of the way. So what's going to be happening? The normal scenario for a defib to be used. Anyone that's not breathing, we want a defib on the case here. So I'm going to get the boys to do CPR, because that's what will be happening. Somebody will be doing CPR, and then we go and get the defibrillator. The pictures are going to tell us exactly what to do. So somebody goes and gets the defib, and the defib will arrive while CPR is going on. So I'm going to get William to do CPR, and then me and Alex are going to put the defibrillator on, because William's not going to stop CPR because we get the defib. Now, we're going to show you exactly what would be happening. Just wait on, William, just because you will get really tired. Okay, I'm just going to get our little remote control out here. This one's a training model as it is. So, we've arrived at the scene, and William is doing his CPR. So, William, if you want to have a crack on. So, Alex, do you want to press the on button?
Training scenario. 1. Adult patient. Call for medical assistance.
Okay, so we've done that. We've called the ambulance.
Remove clothing from patient's chest to expose bare skin.
Okay, so we've got bare chest, so William's not stopping.
Pull green tab to remove pads.
Okay, it's telling me where the pads are, so I'm just going to pull them out, and there's my
Peel
pads.
pads from liner.
It's got pictures about where we put them on the
Apply
chest.
pads to patient's bare chest, as shown in picture.
Okay, so I'm following the
Press
pictures.
pads firmly to patient's bare skin.
One goes right where the side here, just on the left-hand side.
Pull green tab to remove
And
pads.
it's just going to keep repeating it until I
Peel
do what
pads
it
from
wants.
liner.
Okay, so I'm just going to put this. This one goes
Apply pads
just
to
above
patient's
the
bare
right
as
chest,
shown
so
in
just
picture.
there. It's telling me to follow the
Press
pictures as
pads
well.
firmly to patient's bare skin. Assessing heart
Okay,
rate.
so
Do not touch the patient.
Okay, so it's sensed that those pads are on.
Analyzing. Do not touch the patient.
So it's looking. They just lost their stick a bit. So it's
Stand
looking for
clear
that.
of patient.
So we need to be nice and clear here.
Shock advised.
Okay.
Stand clear of
So
patient.
it's telling me that we need to shock it now.
Press the orange shock button now.
Okay, so it's flashing and telling me to press that button.
Press the orange shock delivered. Begin CPR.
Okay, William, back on again.
It is safe to touch the
Shoulders
patient.
right over. There you
Place overlapping hands in middle of chest.
go. He's doing all the hard work, isn't
Press directly down on the chest in time with metronome.
he? So it's even going to show me the rhythm. Okay, it's flashing.
Good compressions.
Okay, it likes William's CPR, and it's going to beep for the rhythm that we need. The defibs are so clever
Good compressions.
that if it thinks William's not pressing hard enough, it will tell him.
Push harder.
There you go, so it thinks he needs to push harder on that one, okay? I'm just going to turn the defibrillator off now and give William a bit of a rest. Well done, you. Good CPR. So, these sticky pads have just lost their little bit of stick, but they will go on the real one. So, we just keep going with this. So, every 2 minutes, the defibrillator is going to do a check again. So, it will tell William to stand away from the patient, and it will say, I'm looking for the rhythm, and it will do what it needs to do. And it'll either say shock advised or no shock advised. If it says no shock advised, we just continue with CPR.
CPR and you're getting too tired?
You take a rest, and then you start again. Yeah.
But what if in that rest the patient dies?
We will never know that. Okay, but the biggest thing with first aid, William, and it's a really good point. Just do your best. That's all you can do. If you are too physically tired to carry on, you've got no option, have you? You just carry on. So you take a quick break and then you jump back on it as well. All the time.
My arms ache and really hurt, then I let someone die.
The good thing is if anything like this is happening, an emergency, you're going to have this chemical release in your body called adrenaline. And that's going to give you lots of focus and lots of strength, lots of problem-solving abilities, so your body does help you get through these kind of situations as well. So
Does it also make you nervous?
It can be, yeah. It's the same thing that you get when when you sit your 11 plus or your exams and stuff like that.
Yep.
That feeling as well. Fabulous. So these are defibrillators. We'll do a little bit of a section about how we find them, an app that you can use as well, just so that we know where they are. But it's a really good thing to know in your local environment, your local community, where your defibrillators are, because the public access ones are there for you to use. You don't need any training to use them. They're really simple. As William said, they are really, really idiot-proof. So give them a go. Really, really good bits of kit. So defibrillators, pretty idiot-proof to be honest. So I hope you understand how easy they are to use, but I can't stress how important they are as part of that chain of survival. Really, really important. They had about 40% chance of the person surviving, so really, really important. So how do we find them? First of all, keep an eye out for them. So what we're looking for is, they're usually in big yellow boxes or maybe red sometimes. And we're looking for a green sign as well that says AED on them. So AED just means automated external defibrillator. So if you see AED, it's the same thing, same. And in the lockable cabinets that you see around, they are just normal defibrillators. They're just in kind of vandal-proof and weather-proof boxes so that we can access them. Now, there are a couple of apps out there. I use one called Save a Life, which will tell me where they are. They use GPS location. There are a few being developed now, so keep an eye on the App Store for those. We're just really praying that Google Maps eventually gets around to putting defibrillators on there. It would make life so much easier. Now, when we get to the box, it will be locked most of the time, so we need to be able to get into it. Now, most of them have a keypad code on them. Now, the instructions on the box will tell you exactly what to do. Most of the time, it's going to tell you to ring 999 or 112. There's usually a location code on the box, and you'll be asked what the location code is by the call handler, and then you give them that. They give you the code to get into the box. Now, the important thing here is obviously if we send a bystander to go and get a defibrillator, we need to make sure that they've got a phone. It's one of those things that when we panic, we can forget really simple things like that. So when we send them off, they need a phone so that they can be able to call and follow the instructions. Then they just bring the defibrillator straight back into the action. And then, as we showed you in the video, CPR continues and the defibrillator is then put on. When the defibrillator is attached, when the paramedics arrive, they will actually take the defibrillator away with them, and then that will be sorted out on how the defibrillator gets replaced, and nothing really for us to worry about. They are becoming cheaper, they're becoming smaller, and I'm fairly sure in years to come, they will become a bit more of a common item, maybe even household items as we go along. They are super important. So defibrillators, just remember them, don't be afraid. We want them involved. If anyone's not breathing, we want a defib. For the next section, we're going to look at choking. Please excuse the crazy hair. During one of the live shoots, we behaved like crazy scientists, and so our hair was pretty funky during that. But during the session, I wanted to show people how an object blocking the airway works. And so we make a set of lungs. Very, very simple to do. And in my training courses, I use a device that's specifically designed to show this. It's a choking vest. And what we do is we block a tube with a foam dart, and the students on the course have to come round behind me and squeeze the balloon, and it pops the dart out. Now, I really wanted to show you how that works. And again, because you don't have this training equipment at home, we're going to make one. So all you'll need for this section is a cardboard insert from a loo roll. You'll need some of the loo roll as well, a small plastic bag, like a sandwich bag, and some tape. We use sellotape and parcel tape in the video as well. So if you get those together, and it will really help you understand how choking works and how we help somebody. Because as long as we understand that it is squeezing that balloon to pop the object out, it all becomes very, very clear how we deal with it and how we adapt when the situation might not be perfect as well. So good luck with this. Have a go. A lot of fun. So we're going to be looking at choking today. So first question is, what is choking? So we're going to give you 3 possible answers, and Alex is going to read them out. We'll hold them up.
So A, when you have lots of snot in your nose. B, when the tube that you breathe with becomes blocked.
Okay, so a blocked tube that you breathe with, or what's yours, Alex?
C, when you miss a penalty at football.
Okay, should we swap them over? Okay, so we're going to raise the right one. So I hope we've got lots of answers. Is it A, when you've got lots of snot in your nose? Is it B, when the tube that you breathe with gets blocked? Or is it C, when you miss a penalty at football? So we're going to go 3, 2, 1, and the correct answer is going to raise it up. I think you went a bit early there, didn't you, Alex? Yeah, it is. Yeah. It's when the tube that you breathe with gets blocked. Now, that might be with a small toy, or it might be with grapes, or food, or anything like that. Anything. Tic Tacs, mini eggs. Yeah, we get quite a lot of that this time of year when people get mini eggs lodged in their airway.
Eggs, like chocolate.
So, what we've got to think about with this, with choking, is that we've got a tube and we've got 2 balloons here, and they're full of air. And I want you to really remember that, because that's the bit that we're going to be making later. Now, how will I know if somebody is choking?
Won't they make a really weird noise? They might.
Well, we've got...
First, there's mild choking. So in mild choking, you'll cough, and you might be able to say a few words, but you'll just be like spluttering.
Yeah.
And then with serious choking, you won't be able to talk, and your breathing will sound a bit like really like that. So
okay, so William's
you can't get air through.
William's absolutely right. There is 2 types of choking. We've got minor choking, or kind of not dangerous choking, so mild choking. And this is where we call it food going down the wrong way, and it's where we get an object that goes into the bit that you breathe with instead of the tube that goes down to your stomach. And that will make you cough and splutter, and that's the body's way of getting rid of it. And William's absolutely right. They'll cough and keep coughing and coughing. Now, they're really quite simple for us to deal with. We just ask them to keep coughing, don't we? Yeah, we're not going to give them any water. Don't hit them on the back at this point. Just let them keep coughing. Cough, 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 cough. Now, that's the 2 different types of choking. But we said, how will we know when somebody is choking?
Alex?
Yeah.
Is it when so if you don't know they're choking,
you ask them to speak?
Yeah, so we ask them a question. Are you choking? I know that's really crazy. But all we do is we say, are you choking? And if they can't answer us, then we know it's the severe one. They can't talk to us. And generally what they'll do is they'll bring their hands up to like that. So they can't make any noise because their tube is completely blocked. No air can go in and out.
Then the lady.
Oh, we're not going to know. That's a different one. That's the anaphylaxis one. But the biggest thing with choking is prevention is so much better than the cure. So how can we make food safer?
Like chewing it and cutting it.
Yeah, absolutely. So cutting things up, things like cherry tomatoes, grapes, sausages. They've got like stringy bits of meat and things like that. So we cut them up properly, we chew them properly. And I always remember now, and I hope my dad is watching, I always remember now when my dad said, sit on your bum whilst you're eating. Because when we're running around, what we tend to do is we tend to breathe in the food instead of swallow it. Absolutely. So make sure that we're being really, really safe before we do that. So that's really important. So what we would normally do is the person would be standing up or sitting down when they start to choke. Now this is Billy, and we use him to demonstrate CPR. And if you remember CPR from our first, we've got Annie, and then we've got little baby Annie as well. So if Billy is standing here, and Billy I know is choking now, first thing that I'm going to do is I'm going to shout for help, because I want one of the grown-ups to come and help us at this point. Now what we do to start with is we're going to put our hand over Billy's chest. Now, as you remember, I said that his lungs are a balloon, and it's half full of air, and he's got like a marble or something stuck at the top of the tube. So we want to squeeze the balloon and pop the marble out. So I'm going to put my hand over his chest, leaning forwards, and I'm going to use the same bit of the hand that we did with CPR the other day, and we're going to hit him right in between the shoulder blades as hard as you can, okay? And we're going to do 5. These are called back blows. 2, 3, 4, 5. Okay,
I'm not dead.
you can be hit quite hard between the shoulders. You and your brother know, right in between the shoulder blades, and we're going to try and get that out. Obviously, keep an eye on what's going on with his mouth.
What if nothing happens?
Well, we're going to tell you that. Okay. So if it comes out, obviously stop hitting him. Just because I said 5 times, if it comes out, don't need to hit him. Right. So it's, as Alex said, it's not come out. So what we're going to do is we're going to go behind Billy. And I'm going to find out where to push him. So we're going to push him just in between the ribs. So how I find that the place to push is we find the bottom of the ribs. So if you do this, if you find the bottom of your ribs with one hand, and we find your belly button with the other, and then move your fingers together, and that little area there is the squidgy bit that we're going to push in. So Billy stood up like this, and I'm going to make a fist, and I'm going to push it into his tummy, and I'm going to put my hand on it, and I'm going to move in quite hard and roll upwards, okay? So 1, 2, 3, 4, 5. So we're going to do...
And shouldn't it now come out?
Hopefully it's going to have popped out.
Once it happened, still.
What if it hasn't? So we want you to practice this on Teddy, okay? So give this a go, and the boys are going to show you how it works on me, okay? This bit's really important. So we're going to do 5 of the back blows and then 5 of the tummy pushes. And if we've done 5 back blows and 5 tummy pushes and nothing's come out, this is the point we want to call the ambulance. We want you to call 999 and make sure that they're on their way. So I have, when we train first aiding, I have my special choking vest. So what we're going to do, just because of the camera, William's going to just kneel behind me today. Normally we would be stood up. So this is my choking vest. So I've got this on for a bit of protection. And also, I've got a blockage in this tube just here, okay? So we've actually got 2 blockages in there today from when we were practicing earlier this morning. So we're going to take one of those out and we're going to pop that back in. Okay, so William is going to... Do you want to have a go on, Billy, or are you going to have a go on the choking vest as well? Choking vest. So put your hand across there, William. So he's going to lean me forward and hit me on the back 5 times. Okay, it feels like you really wanted to do that, yeah? Yes. Okay, so William's going to put his fist in the middle of my tummy and he's going to squeeze really hard. Good, and then as you can see, the object's come out the first time of doing that. So I want you to have a go with Teddy at that and see if you can make 5 back blows and 5 tummy thrusts as well. Alex, are you going to have a go? Yeah? Okay, so hand over my chest there, that's important. It supports me, stops me falling over. Okay, brilliant. Okay, that's not worked, so you're going to need to do the tummy thrusts at this bit. So come all the way around. That's it. Put your fist in there and squeeze as hard as you can. Let's see. Good. So first time. So you can see, even if it's a grown-up that is choking, you can help. You really can. You've got the strength to do that. Now, if the adult is a bit bigger than you, what you can do is you can push them up against the wall and you can push from the front. Some of you might not be able to get your hands around their tummy. Now, I'd love you all to have one of these to have a practice at home, but I know that you don't have that equipment. We have these on our courses. You're very lucky. These are really good for practicing. So this is where we had our idea of making one. Okay, so this is, if you can get your kit together. So William, if you want to pass this, we're going to make one of those choking vests so you can have a practice to you. So, right, so what we're going to do to start with, we're going to get the tube, and that is our Airway. Okay, that's the Airway. And we're going to get the small plastic bag, and we're just going to put the end of the, we're not going to go yet, Alexi. We're going to get the end of the bag, and we're just going to wrap it round because we're going to need to try and seal that. Okay, so we've got the tube and the plastic bag dangling down. So we're going to do this quite slowly to give you time to do this at home. And then we're going to get your sticky tape, and you need to stick the bag to the tube so it makes a seal. That's perfect, Alex. Yeah. Do you want some scissors? There you go. Yeah, you need quite a bit of tape on these. And Alex this morning decided to stick his lips to the
sellotape.
To the sellotape.
To rip off.
No, I think that was your brother that did that.
Yeah, I did rip off.
Yeah.
which very hurts.
Okay, so lots and lots of tape around there so that we know that that bag is not going to come out.
Because when we did it this morning, it was keep on coming undone.
It did, didn't it? Yeah, so we had another test run this morning. And it worked, didn't it? Just wait, William. We're going to just we're going to talk to everybody and tell them what we're going to do. So what we're making here is the tube is the tube in your body that takes the air down to your lungs. Now we're making one lung today. Okay, it's just a bit simpler than doing a model with two of them. But that's basically what your lungs are. Is they're a big bag, and that's where you breathe. That's where the oxygen goes into your body. Into the bloodstream, okay? We talked about the blood going around last week, didn't we? You need some more tape? Yeah. Okay, yeah. So you need quite a lot of tape with those. So what we're going to do now is
some more tape.
Yeah, is with your just out of the way a second there, Alexi, well done. Yeah. So with your loo roll now, we are going to be just make a small ball, nothing too heavy, don't compress it too much. And first of all, we're going to blow into the bag, into the lungs, so that it fills the bag up with air. And then quite quickly, we're going to push the object as if it was choking and you were blocking your airway. Oh. Okay, so we've got our lung full of air, and we are going to pop it out. Okay? And that is exactly how my choking vest works. And we're hoping that you can have a practice with that with your teddy. So you boys did that perfectly, yeah? It worked? Yeah? So should we have a quick competition to see who can get
the camera?
The camera, okay? So let's see if we can get the camera.
Win first.
Wait, no.
No, this one's too small.
Okay, so we've got it in there. Are you ready? We're all going to have to do this at the same time?
Nope, I'm not ready.
Right, okay, so the object, and this is exactly how choking is. Now, just one really, really big thing is that we are doing this as a science experiment today, and that's why we've got crazy scientists here, but I need you to remember that plastic bags aren't toys, okay? They're not something that we should be playing around with without Mummy and Daddy being there, because this actually can stop us breathing if we never ever put these on top of our head. Really, really important, that one, so they're not a toy. But let's have so one of our jobs as well is not just looking after the people physically like we've been doing in the video so far, it's looking after them emotionally. Now, a lot of people when they're feeling not very well or they've been injured feel quite vulnerable, so it's really, really important that you keep very, very calm and that you reassure them constantly that they're going to be okay. Now, when people are injured, they'll mirror you, so if you're panicking and you look scared, they will behave in the same way as well. So it's very, very important that you keep them calm. For their medical health as well, it's really important that they stay as calm and as still as possible. We always want to keep people nice and still. So make sure that we're reassuring them. Keep talking to them. Tell them that everything's going to be okay. Tell them that the help that you've organised is on the way. It might be their parents. It might be the ambulance. But keep talking to them. Sometimes because you're a close friend, they'll look to you for reassurance above the leaders or the grown-ups that you're looking at as well. So you can be a great help to the adults around you at this point. Again, ask them, is there anything else that you can do that would make them more comfortable as well? So keep checking with them, and their situation changes as they're waiting as well. So keep going back, keep reassuring them, make sure that you keep them warm at all times. Don't give them anything to eat or drink as well at this point until you've been advised by a leader or grown up. So yeah, you can really, really reassure them. So well done so far. Keep going with the video. Right, in the next section, we are going to be looking at blood. Okay, normally on my first aid courses, I tell people, I really hope you don't have to deal with any of this. But guess what? Bleeding, yes, you will have to deal with at some point. Hopefully only minor. So in the first part of the section, we're going to have a look at just the principles about stopping bleeding. And then we're going to have a look at just dealing with a small graze on Alex's knee. Then we're going to have a look at a more serious bleed. And then we'll have a look at head wound and also a nosebleed as well. So have a look at this. The principles apply pretty much to all of it. So nothing to be worried about. We will warn you when there's a bit of gore on the way. what we're going to do now is we're going to move on to the bit that we know that you want to do, the gory bit, the blood. Okay, so we're going to be having a look at this. So I'm going to ask you now a question. Why is blood so important? Okay, and we're going to give you 3 answers. And so we want, my technical manager is looking at the answers now. We'll see if anyone gets some.
B, it carries lots of important things.
Should we start with A? Let's start with A.
It's red because it's William's favourite colour.
Okay, I'm going to bring these in so you can see these. Is it A, because it's William's favourite colour? He's an Arsenal fan, that's why.
C, without a vampire.
Should we try B?
Oh yeah, B.
Yeah.
It carries lots of important things around the body.
Is it B? So just as Alex said, it carries lots of important things around the body.
Without it, vampires would go hungry.
Or is it C? Without it, vampires would go hungry. Okay, so which one do we think it is? Are we getting any answers?
Let's go with B.
We think it's B, absolutely. So B really does a really important job. So blood carries lots of things around the body. It carries oxygen, which we need. It carries your food around to give your body energy. It carries things around that fight infection. And it also carries things around that stop the blood coming out. So if you injure yourself, cut yourself, it stops the blood. It forms something called a clot. Okay, so it does loads and loads of really important things. Now, it gets round the body with a heart, okay? Lots of B's. I'm being told a lot of you shouted B out. Awesome job, good first aid. So it gets pumped around the body by the heart, which is a big pump. Now how that works is we've got a water bottle here, which we're going to show you how the heart works. So if you imagine that the water bottle is the heart, are you going to do the squeezing? Yeah. So Alex is going to show you what happens. So when the heart squeezes, it pushes the blood out of the heart, and then the pressure takes it around the body. So it does an amazing job. That's called your circulation. And the tubes that carries it round are called arteries and veins. Now we've got a new worksheet for you at the end of the session today. So make sure that you remember that one. Veins and arteries. They're the tubes that take them round. Okay. So the blood is really important. So we need to be able to stop it from coming out of the body. That's the really important thing. So, first of all, like everything, what's the most important thing we do before we treat anyone?
Look at danger.
Danger detectives, yeah, absolutely. So we're going to check the scene and we've got to do our jazz hands on.
Yeah.
Oh, danger. One of the things that we need to do, we need to try, blood can carry some germs in it, so we need to make sure that we're stopping that. How are we going to do that, boys?
Gloves.
All right, pop your gloves on then. So if you can, and in your first aid kit, before you do anything with cuts, try and put your gloves on, okay? So first aid gloves. Blue's my favourite colour, so it's a good colour for us.
No, it's not. He's an Arsenal fan, so don't worry.
Yeah. And who do we support? Leicester. That's right, blue's a good colour. Right, so we've got our gloves on, really important. Now, a lot of the time, if we're putting a plaster on, you might not put your gloves on, but make sure that you wash your hands properly before we do it. And after we've treated them as well. And what song do we sing when we're washing our hands? Happy birthday twice. Brilliant. We're all expert hand washers at the moment. Right. So we are going to we're going to have a look at what we do if somebody's cut. So the first thing that we do is we check for danger. Now, because the person might be a little bit wobbly, if they're cut, they might feel a little bit faint. The biggest thing that we need to do is sit them down. Okay. So put them on their bum before they fall down, okay? So either sit them down or lay them down so that they're not going to hurt themselves if they fall over, okay? And the next thing that we're going to do is I need to look at the wounds, okay? So we're going to have a look at it. So you can do this with Teddy, so or you're grown up there. So make sure that we sit them down and then we're going to have a look at the wound. And I want to see if there's anything in it, anything stuck in there. It might be gravel or a thorn or glass or something like that. And then we are going to, after that, we're going to put some pressure on it. And what's the, how do we remember this? Press. What I want you to remember to do, how we stop bleeding is we put pressure on it. We press, okay? If you've got your gloves on, it might just be your hands that are doing that. Or we might use a bandage to do that as well. So we've got some bandages here. Now what, boys, if we don't have bandages, what can we use?
Loo roll, tea towel, and some tights.
some tights would do, a scarf would do, a tie, some clean, anything that's clean, yeah? And we put that on. So I want you to see if you can stop the blood on your grown-up or on your teddy. We're going to press, press, press. That's what they're the words I want you to remember. Press, 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 okay? Can you put pressure on Teddy's wound? Yeah, brilliant, well done. So we're going to press, 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 okay? That's how we stop bleeding. So sit them down, okay? Have a look at the wound to make sure it's okay, and then we're going to put pressure on it. So what we're going to do now is we're going to get you guys to start bandaging some stuff up, right? The first thing that we're going to deal with is Alex now has got a graze on his knee, okay? Oh, it's not sticking now. I think our glue's dried out. There it is, it's on the top. Fabulous, right? So we've got a graze on Alex's knee. So how would we deal with a graze?
Would you use a simple plaster?
Yeah, absolutely. So grab me a wipe. That's it.
To get all of the like if
Yeah.
you gravel or something, get all of the things that could cause infection out of the wound.
That's it.
And
Perfect.
then cover it up
So
there's no more.
These are the little wipes that you get in your first aid kit. So we're just going to give the wound a wipe. If you do this, doing everything with your gloves on makes life a lot harder. One of the hardest things I ever have to do in first aid is actually put a plaster on somebody when I've got gloves on. So we're going to clean the wound there. You're being such a brave boy, Alex. Well done. Okay. And then we're just going to get our plaster. We've got some really funky children's plasters here. Look at those. Not your boring old skin-coloured ones.
Yeah, those are boring.
Yeah. And we're just going to get a plaster. What are you doing there? You trying to blow your hand up?
Yeah, it was working earlier.
Do you remember that I can make a chicken out of gloves?
Yeah.
Yeah? Right, so we've got our plaster, and then all we're going to do is we're going to put that over the graze, and we're just going to make sure that it stays nice and clean. But that's great, because it means Alex can go back outside and play, and it'll keep that nice and...
With my friends.
Oh, you taking that off already? Yeah? Oh, you're going to put it back on. Fab. Right, so that's how we deal with just a small glaze. So all we do is we clean it and then we cover it. So that was our small cut. So we're going to move on to something a little bit bigger now. So we did a shoot outside, and we used the same setup as when William did his really bad scene assessment. Now, Alex again cuts himself in this video, and we'll show you how to do a proper scene assessment and then how we'll dealing with a bit more of a serious bleed as well. And we tried to make it a little bit more realistic. So there is a little bit of blood and there's a fake wound in this one if you are a little bit squeamish about these things. But we'll show you exactly how to deal with it and how we did it on the day.
Ow! Ow! Ow!
Alex, are you okay? Okay, just stay where you are for me. Okay, so I'm just going to have a look at any dangers over here. So obviously trip hazard, the knife is a danger for me, okay? So I'm making sure that we're perfectly safe. So get all of these. Alex, I'm just going to get rid of that and get them out of the way. So I'm quite happy that we're okay now. Alex, okay, what happened?
I was grabbing the knife with the wood and I cut myself.
Okay, William, can you grab me the first aid kit, please? Okay, Alex, I'm just going to roll you over so I can have a good look. What I want to do now is I've done my initial assessment, my danger and response. So he's responding. I need to have a look at the wound now. Okay, so I'm going to grab my first aid kit and get some gloves on because we're dealing with blood. Okay, Alex, it's fine. You okay? We're going to keep you nice and safe. Don't you worry. Okay, we're going to look after you. So before I do anything with the cut, I want to examine it. So I need to see how far. It's bigger than it looks. So I'm going to need to get to the wound. So I'm going to get these good pair of scissors, specially designed for cutting clothes, and I'm going to get to the wound. Okay, so we can now see the cut. So yes, it's definitely a serious bleed. We're going to really need to deal with this. So as you can see, Alex has got quite a nasty cut, so we're going to have to get onto this pretty quickly. All right, Alex, I'm just going to put some pressure on this until I can get a dressing. So I'm going to go straight in here, and I'm going to get a decent sized dressing, and we're going to cut this and get some pressure on it. Okay, pressure. Pressures are a really, really important thing. So straight away, just get straight down to the pad, and we're going to put the pad directly onto the wound, and we're going to press. Okay, so I've got lots and lots of pressure on this. Okay, it's a really, really bad cut. So we might want to be thinking about getting the emergency service on the way if we can't control this. Now I'm having a look now. We should keep pressure on it for about 10 minutes just to see if anything's happening. How are you feeling, Alex? hurts. Okay, I know. We're going to just put some pressure on it. So what I'm doing at the moment, I'm keeping an eye on Alex himself, asking him lots of questions about how it's going. If he starts to feel faint or dizzy or starts to go grey, I'm going to start thinking about shock, which we've got a different position with that, which we'll show you in a moment. Okay. So we're going to fast forward a bit. This is actually stopping it now. Okay, so we've got control of the bleeding. So what I need to do is I'm going to need to bandage this over. So I'm just going to raise your leg up a little bit there, Alex. Okay. And I'm just going to go round and we're going to tie this quite snugly. Now the big thing with the bandaging is to go over both ends of the bandage. We want that bandage to be fastened against Alex's leg. So that just means that the blood won't pour out of that when we're doing it. Alex, could you just hold that for me? Yeah, see, look, they've got 2 hands as well. They can help you. And we're just going to put quite a bit of pressure on this. Okay, and if you can, tie that knot directly on top of that wound, okay? So what we're going to do is tie that in a double knot. It just tells me where the cut is, and also it adds a bit of pressure onto it. Now, if Alex is starting to feeling a bit faint and he's starting to feel a bit woozy, I'm going to get Alex to lay down for me. Alex, okay, pop your head down there. Now, what I want is something to put underneath his feet because I want to raise his legs. And we're going to do that and get that up in the air there. Now, that only needs to be 15 to 30 centimetres. You can just use your legs as well. Obviously, I can get them up there. But what we're doing is we're pushing all the blood directly into his body, to his head, which is the main part there. If he goes pale, and we've got a nice simple rhyme here, if the face is pale, raise the tail, get those legs up in the air. Now, this is where, again, if we were in a cold environment or we needed to maintain temperature, something like a space blanket or something like that, just to keep it nice and warm. Grab hold of that, Alex, and pull that over you. Okay, and we keep him nice and safe there. Okay, so that is how we deal with a wound. Remember your Dr. ABC. Danger, look for danger, check for a response. Alex was responsive, so there's no need to check the airway or the breathing because he's already doing those. We go straight to the circulation and check for bleeding, which we did. Remember, sit them or lay them down, examine the wound. I want to see where it's coming from, whether there's something in it, and what type of blood it is as well. If it's squirty, it's really serious. Obviously, we need to deal with that. And then press. Pressure for 10 minutes, bandage it. Obviously, if it stopped bleeding. If it hadn't have stopped bleeding, I just would have applied another dressing. If it bleeds through those 2 dressings, remove both of those and pop a fresh one on, and it's 2 on, 2 off, 2 on, 2 off, and we just continue until we've got help. Okay. So we hope you found that helpful just on how we actually deal with things. We tried to make that a little bit more realistic and based on injuries that I've dealt with in the past. So what we're going to move on to now, grab your bandages, grab a grown-up, grab a teddy, whatever you want. We're going to be doing some head bandaging now, and we're going to be looking at nosebleeds as well. Look now at the ones on there on your heads, okay? So the bandages, can I borrow you, William?
Yep.
Yeah. So these bandages, when you undo them, when they come out of their packet, these little wings are always folded over like that. Now with the head one, if I do it like that, all the blood's going to run down into my eyes. So we just keep these little wings folded over, and they'll actually come out of the packet like these. These are training ones that I use for my first aid classes. So all I'm going to do is William's got a bang to the head. Keep nice and still for me. And this just goes over his ears, and it goes under the bump in his head.
And we've got another one if it's...
Yeah, we've got loads of bandages here, haven't we? Alex, do you want to do Teddy? Do you want to see if you can do a bandage on Teddy? Or are you going to do it on... Let me just show them properly and then you can have a go on William whilst they're doing their bandages.
Why is someone doing on me?
Oh, I think you're the expert patient.
Yeah, and you get loads of bumps.
To be honest, William, why do you think we're doing these on you? How many cuts to your head have we had to do this on?
Let's think.
100 times.
3 of them.
3 times. So William's had to go to hospital 3 times for cuts to his head. So these are quite common. So yeah, really, really important. So this is a really nice, easy bandage. And again, that's it. So yeah, we can make that a bit more comfortable there. Just take it off his eyes. But the big thing is we've sealed the bottom of the bandage, so hopefully that blood's not going to pour into William's face as well. So that should really, really help. So our head bandage, we hope that you're doing a really good job with Teddy or the grown-ups. We'd love to see loads of pictures with the grown-ups with looking a bit silly with their bandages as well. All right, now, Alex, how are you getting on with Teddy?
Good.
Oh, that's an awesome bandage. Yeah, can I have a high five for that? Good job, good bandage. Okay. Yeah, how are you doing? You okay?
Yeah.
Yeah, you feeling better now? You think you look a bit silly?
A bit, yeah.
Yeah, you look really good, mate. So, brilliant. So that is our cut number 3. So we've done our graze to the knee, we've done our cut leg, and now we've done our bandage to our head. So loads of practice at home. Practice really does make perfect. So if you've got some more bandages, it's really, really awesome to do it. Right.
So we used to do these now. I mean, I am.
Well, we're going to do the problem that Daddy's got, haven't we? So, boys, what happens if you pick your nose?
You get nosebleeds.
Sometimes you get nosebleeds, yeah.
Yeah, because the artery, the veins get like cracked or something.
Yeah, so you've got lots of little ones in your nose. So picking it or having a bang to the nose, both of you guys play rugby, yeah? So
Our girlfriend, she has that a lot.
yeah, so we might get a nosebleed. So I'm going to have the nosebleed, okay? So this is me now. Let's have some fake blood so it looks real. We like Halloween in this house, don't we?
Yeah.
Okay, so I've got a nosebleed. Oh no! Gore, is this a gore? I think this might be a bit of a gore alert, is it? Right, so I'm having.
Gore alert.
I think
That's
I've
what
got
I do.
quite a bad nosebleed. So, boys, you're the first aiders. What do you do to treat me?
Pinch your nose.
So I'm going to pinch my nose, yeah, the soft part. Yeah,
soft
the
part.
bottom.
Lean back.
No.
Forward.
We lead
Forward.
forward, yeah.
And then
And
Take
I-
a bit of tissue.
Yeah.
And hold it at your bottom so
Yeah.
as the blood drips, it comes to the tissue, and then after about 10 minutes, you can take your finger off
yeah, after 10 minutes, yeah.
and then just wipe the rest up with a wipe.
If it's stopped, great. If it's not stopped, do another 10 minutes. Okay, and we try again after another 10 minutes if that's still bleeding. If you've done that 3 times and it's not bleeding, they need to go to hospital or get the grown-up to give 999 or 111 a call, and they'll be able to help them with that one, but they'll need medical treatment. But normally they stop relatively easy, but it has to be for 10 minutes. Get the person to sit down and keep nice and still, but we pinch the nose. So I want you guys to do this at home. So lean forward, pinch the nose, and give them something just to mop the blood up with it, just that bit there. How am I doing with blood, Alexi?
Good, you still got a bit down here.
Still got a bit down there, have I? Oh, it's okay. So well done. We're moving on to another section now. We're going to have a look at asthma. One of the big things with asthma is that we tend not to take it too seriously. It's a very common thing. About 1.5 million sufferers of asthma in the UK. So you probably know people at school or in Scouts or Cubs that suffer from asthma. And it is important that we take it seriously. So we'll talk through how we recognise it and what to do if somebody's having an asthma attack now. So wheezing. So we're going to talk about asthma now. So do you know what asthma is, boys?
It's when, isn't it? It's in a way. It's like you need medications to help you with your breathing.
Yeah, absolutely. So asthma is where people have got a condition that makes breathing difficult sometimes, and they take medication to make this easier. And there are lots and lots of people in the UK. It's over 1.5 million people in the UK that have asthma. Yeah. So a lot of people that we know. Yeah. So most time at school, we know people that have got asthma.
Yeah.
So it is common now because it's really common. We tend not to think it's very serious, but it can be really, really serious. So it can kill you. So we need to be, we need to know what to do. So what happens is, on our normal breathing, we've got a tube like that, and it's really, it's wide enough and we can get enough air in. It would be like having an asthma attack would be like trying to breathe through the straw instead of breathing through the tube. So their tubes get inflamed and they get narrower and narrower. And in an attack, the muscles round the tubes can constrict and stop their breathing. It's smaller and smaller, yeah, absolutely. Yeah.
And then they can just end up as no gap.
Yeah, apparently having an asthma attack is like trying to breathe through a straw, so you just can't get enough air. No, we're not going to do that. You'll go really lightheaded. Okay, so how will we know if somebody's having an asthma attack? How would you know, do you think?
So they'll start breathing normally, and and they'll get heavier and heavier, and they'll start wheezing more and more.
Wheezing is the noise that they make, yeah. So it's a really kind of muscular noise, and it's a very active sort of breathing. At the moment, we're just breathing nice and normally.
Loads of people have me walking around if they have asthma.
Yeah, we're going to get those. Can you get those out for me then, Alex? Get all the asthma stuff out. So the noise that we think that they're going to have is this. It's like a really wheezy noise. And one of the other classic signs is that they can't make a sentence as well. So you might ask them if they've got their medication, and the noise that they'll make is so they can't make a full sentence sometimes. They might have a really tight chest, and we might start to see their lips going blue. So what might their lips going blue tell me?
Don't worry, because this has got the lid on.
Okay, good.
The
Okay.
lips going blue.
Yeah, what that tell me? Okay.
Wouldn't it tell you that they've got asthma?
Yeah, it might be, but it just means that their oxygen in their system. We talked about how the blood carries oxygen around. It can do, so that could be cold, which we're going to deal with next week. But yeah, so it could be that they're having an asthma attack. So they get very tired as well with their breathing. So if we spot somebody that's having an asthma attack, boys, what do?
Get their asthma.
Yeah, we ask them where their medication is. Now, they will normally carry a couple of types of pumps. Oh, you've really done that in there now, Alex, haven't you? Yeah? Right, so
yes.
Normally they've got a traditional sort of colour band, but the asthma inhalers do come in different colours and different shapes as well. Now, the blue one is normally the one that we want to get them. This is the one that relieves their asthma and makes it a little bit better, okay? Some of the time, you're absolutely right, William. This is the preventer one. So this is the one that they take in the morning as their medication to stop them having an asthma attack.
What happens if they lose their asthma thing?
Well, if they lose their asthma thing, or if we ask them and they haven't got their medication and they're struggling to breathe and they're wheezing, it's a brilliant question, Alex. We're going to call the ambulance, okay? So we need to take that really, really seriously. So we're going to let them take a couple of puffs of their medication. They'll know how to do this, and then we're going to wait for a couple of minutes, and then they might need to take a couple more.
Look, it's got instructions.
Obviously, we're going to get a grown-up here, but after about 5 minutes, if it's not getting any better, we need to call an ambulance.
So you get this,
boys,
and you open it, then you put it in there.
So these, they might ask you to get something called their spacer. Now, this is just a device that makes it a bit easier, as Alex sort of jammed it in there earlier. They just fit these into these devices, and it just makes it a little bit easier to breathe. So if they ask you to get their spacer, they'll look something like this. So all we can do is get their medication for them. Now, what position do you think, boys, to make it easier for them to breathe, we would want them in at this time? Sitting down. Go and grab a chair each. Go and grab a chair each and bring it onto the mat here. Okay. So there's a reason that I've got two. So just come here so we can see them. Put that one in front of him, Alex. Okay, and now I want you just to cross your arms, will you? And just lean on there. Okay, and that's the position that we want somebody in who's having an asthma attack. Their chest is really open, and it makes it a lot easier for them to breathe. Yeah, you have a go over. So we've got a couple of do's and don'ts with asthma. Okay, so
don't use the medication if you don't have asthma.
Sorry?
Don't use the medication.
Obviously, if you don't have asthma, don't use any medication.
Wait,
yeah, that would
why
be a
do
really
you
good
sit
one.
in this position when you've got asthma?
Because it makes it easier to breathe. So what we do is that we sit them down and we get their medication. And what we don't do is don't lie them on the floor. That makes their breathing more difficult to breathe. Okay? And what we don't do, which we sometimes think might be the best thing, is get them out into the fresh air. So sometimes the change in the temperature or the change in the humidity can actually make it worse. So don't do the fresh air thing. We just want them sitting on their bum, leaning forwards, and get their medication for them. So that's how we deal with asthma. So, right, we're going to have a look at burns now. We do have a bit of a gross alert, a gore alert today. So burns, the biggest thing with burns is don't burn yourself, okay? Our danger detectives are really important on this, aren't they? So what kind of things can burn us?
Oh, soup that have just come out of the cooking thingy.
Out of the microwave, I think it came out of the
Yeah,
out of the
that
saucepan.
came with me.
Yeah.
I touched a hob that I thought was cold, but it was actually hot.
Yeah.
It had just been on.
So
It was
hot
quite
things.
Stupid.
Yeah, so hot things, hot food, hot
And the
water,
cold
hot
things.
drinks, cold things, yeah. Do you want to pass the, we've got a question here for you. So We want to see some answers on the board. So send your answers in. So what can burners? So answer A is, that's for William.
Something hot, cold, or chemicals.
B.
A Chinese burn from my brother.
Playing too many Xbox games.
Are you sure that that could burn you, William, Xbox games? Because you're the expert at playing too many, yeah?
Yeah.
Yeah? So what do we think the answer is? Is it A, something hot, cold, or chemicals? Is it B, a Chinese burn from my brother? Believe it or not, there was one this morning. And C, what's yours, Alex?
Playing too many Xbox games.
So,
A.
our studio manager, what answers are we getting there?
A.
We're getting lots of A. Brilliant. It is hot, cold, and chemicals can burn us as well. So, with that, loads and loads of different things. Cold things can burn us as well, which we tend not to think about that. Believe it or not, again, my boys have been a brilliant example this week. We had a cold burn in the house this week. Alex, what happened with the ice lolly on your tongue?
Oh, so I was eating an ice lolly, and my tongue got stuck to the ice lolly.
Absolutely.
No, you were trying to get your tongue to stuck. You're going like.
But it was completely stuck to the ice lolly. I've never seen
couldn't
one.
take it off.
I've never seen one like that before, and it literally wouldn't come off. But we'll tell you how we treat that when we treat it with burn. So hot and cold, we treated it with water, didn't we? Absolutely. And also chemicals as well. So things like bleach, so chemicals can burn your skin as well. So the depth of the burn, what we're going to have a look at when we look at a burn to see how serious it is, we're going to have a look at a couple of things, and we're going to show you a gross alert. Okay, so if you get something like sunburn, which is red skin, okay, with no blisters, we can normally deal with those at home. Okay, we deal with them all the same way. Now, if you get something where you get blisters, okay, they're a bit more serious. It really hurts, yeah, absolutely. So blisters.
On your back.
But we might get something, and this is where our gross alert is. So either way. This, you might get a burn that looks like this, okay? So pretty grim. Now this has gone through the skin and you're starting to see what's underneath it. Now that is a gross alert, and Alex really doesn't like that, do you, Alex? So now we've got to have a look at burns, see how big it is. With a child, anything, if it's broken the skin, anything bigger than a 50p piece, we're going to get them to hospital, okay? Really important. Burns, and probably the thing in first aid I don't like the most, they get infected really quickly, they scar really badly, they're quite very painful. Yeah, really painful. So we're going to have a look at how we treat it. Now the biggest thing with burns is, if you can, put some gloves on, try not to breathe on it, they get really infected. But cool water, cool water. We want to get to the tap, not cold water, cool water. So we've not got the tap here, obviously, so William's going to treat my really bad burn, and so we're just going to use this and just get some water on it. So I want you at home, I know you guys have got water here, and we're going to keep doing this. So keep doing it, keep cooling that down. And what we do is we just make it cooler, and the burn starts to hurt less, and it will stop doing damage, because if we leave it, the burn will get worse and worse. Really important.
Too cold, you kind of get hypothermia.
Absolutely. So that's a really good point. So if somebody's really badly burned, we don't want to stick them under a cold shower. We just want to cool the burn, not cool them, because you could put them into hypothermia. And how long are we going to do this for, boys? How long are we going to do?
20 minutes. But if they start too cold, we kind of recommend stop.
Well, yeah. So we've got to keep them warm whilst we do this. A minimum of 20 minutes to cool that down, and then when we've done that,
you might need
cling film from your kitchen drawer is the best dressing for this, okay? So all we would do is, it's sterile, but the bit that's been in our kitchen drawer is not sterile, so we're going to tear that off, and now we're going to just layer it really loosely, so don't wrap it around tight, Alex. Oh, I've forgotten one thing. If they've got anything like this, take it off. Okay, we want to get anything that might, when it's going to swell up.
It could cause an electric shock as well, because
okay.
the water.
So just tear it now. Okay. There we go. And so that's what that's done now, is just by putting it loosely over the burn, we've actually created a layer of skin, which is going to stop that getting infected, and then we would be able to get them off to hospital. Okay, so 2 or 3 layers just of skin. But don't wrap it round really tightly, because otherwise that's going to swell up and it might start to restrict the blood, the circulation that we talked about on session 2. Yeah, I think they might not like that.
Yeah.
Well, we're now on to the last section of the course, and in this bit we're going to have a look at heat-related problems. So we'll start off by looking at hypothermia, and then we're going to move on to heat exhaustion and heat stroke. We'll start off by looking about how we avoid it. We'll have a look at times that we might have had it. We're also going to have a look at how we recognise if somebody is having a problem with their temperature. We're also going to have a look at how we treat it as well. Now, being Cubs and Scouts, we like to spend as much time as possible in the outdoors. We have a big thing with our Cub pack that if we don't have to be in the hut, we won't be in the hut. We're always out and about if we can do that. That does bring with it some complications from time to time. So definitely as a leader, I need to keep an eye out on the people around me. We've had some examples where people have turned up in inappropriate clothing, where we didn't feel it was safe to take them into a colder outdoor environment. And prevention is much better than the cure. So if you are asked to provide proper kit, it's always a good idea to do it, and always back up as well. So enjoy this section, and we'll see you afterwards. So in this section, we're going to have a look at hypothermia and the heat-related problems as well. And as Scouts, we spend a lot of time outdoors, so it's really important for us to know exactly what to do. Now, believe it or not, the body is really sensitive to heat. We're warm-blooded and we normally control it. Now, young children in particular aren't so good at that, but babies as well and the elderly. But it's amazing to think that our body only needs to go, how many degrees up or down do you think it needs to go before we get in trouble? Medium. Medium's not a number, so how many
degrees Celsius?
No, how many degrees? What do you know what our normal body temperature is?
37.
Yeah, okay, it's 36, 37 degrees.
Is it like 20 degrees Celsius that we start going up?
No, believe it or not, it's actually only 2 degrees up or down, and our body can start getting into a lot of problems. So it's quite easy to tip the balance with this. Now, believe it or not, you'll see mild hypothermia in particular quite a lot. So anywhere where you might have experienced. So Legoland. Why Legoland?
Because
when you go to the
just one at a time.
splash park.
The splash park, yeah, absolutely. So
it's not for us, but it's for the players. They have to jump into any kind of water.
Yeah, so cold water. So I've definitely been to Legoland with the boys before, and we see the drench tank. So that water's 4 degrees, and you see kids coming out of there, and they've gone pale, and they're doing this. They're shivering. Why does the body shiver?
Because they're freezing.
Yeah, what's the body trying to do?
It's
Trying to warm itself up. Exactly. The muscles are contracting, and it's telling me that the body's cold. So if you see shivering, it's the body. It's start of mild hypothermia, and it's the body's way of trying to warm up. Why do you think they've gone pale?
Because the blood's gone cold, so it's changing from that red colour.
It is to do with the blood. The blood's not going cold. Well, the blood will be chilling down. But what's happening is the body is now bringing the blood away from the skin, and it's bringing it inside to keep the core of their body warm. So so what's going to happen is the shivering's going to happen. They're going to go pale. They might start to get like blue lips, and they'll start to slow down. Their level of consciousness will start to go down and down as they get colder and colder and colder. Now, when it starts to get really bad, the body will actually stop shivering. Why do you think it stops shivering when shivering?
Because they're like going unconscious.
Yeah, the body's giving up. The body's saying, actually, that energy expenditure is not working. So what we're going to do is we're going to save that energy and try and keep the core going. And they will just slow down. Their breathing will slow. Their heart rate will slow down. And eventually they will just go to sleep and they can die from that. Now, it's really important with hypothermia that we recognise what it is and that we take early actions with it. Now, how do you think, if we spot somebody who's been out on a hike, they've got soaking wet, and they get back to the campsite, how can we treat that mild hypothermia?
Fire.
So, actually, what do you mean with a fire?
You put them on a fire, no, not on a fire, like near it.
Actually, what we want to do is everything very, very slow with this one. So
you take off their wet clothes.
Absolutely. The biggest thing with hypothermia is to get them out of the environment. So we want to get them in the hut, we want to get them indoors or in a tent. Nothing as aggressive as a hot shower or a hot bath. or hot packs or next to a fire or anything like that. It's too, the body can't deal with the temperature, the hot temperature next to the skin, so you can cause them damage. Right, so what we need to do is we need to treat them. So we're going to drag them inside, get them inside somewhere, we'll get them out of the environment, get them out of that harsh environment. What do we want to do with the wet clothes?
Take them off.
Yeah, exactly. Yeah, get them off and replace it with warm clothes or warm blankets. Now, Alex is doing a perfect job of what we would do. Get a warm blanket round them, so warm them up, get that cold clothing up. Brilliant. William said, is there anything in a first aid kit that we could deal with? Absolutely, there is one in there, William. So find something in there that might be helpful. Yeah.
Not plaster. Not burned, just
yeah. Alex has just picked it up. Absolutely. So Alex has just come back here. So Alex has just picked up our emergency foil blanket. Now, one of the big mistakes that we make, we've got another one here as well, so they come in different types, but they all do the same job. Now, these are the silver foil blankets. Now, one of the big mistakes that we make with these, or people tend to make with these, is that they use them on bare skin, or they use them on a really, really cold person. Now, all it will do is reflect heat. So if Alex is freezing cold, we've taken his clothes off, and we put this on him, it'll actually make the situation worse. So what we want to do is get him dry, get a blanket or warm clothing on him. We're just going to undo the foil blanket.
The only thing I think about is like someone, like, let's say they hurt themselves and it's cold day, it's raining, when you put that on.
Absolutely. So again, a lot of the time when we're using, it's probably a bit noisy, as William said, if somebody's injured, if say they've lost a lot of blood or they've broken a leg or something like that, you've got to keep them warm. Medically, it's really important to keep people warm. We just think it's for their own comfort, but actually bleeding is harder to stop when they're cold, so lots of bad things happen when people are cold. So all we'll do here is get that on Alex, and then we would get another coat or something and put it on. Make sure we're covering his head as well, get a hat on there, and we're just going to keep him warm until he starts warming up. Any other way that we might want to keep somebody warm? It reflects heat.
It'll keep the heat
exactly. Any heat that his body is generating. That's why you can't put it on him when he's freezing cold and he's got no clothes on. Because
the freezing
you'll
cold
just reflect
will
cold. Yeah, exactly. So that's one of the mistakes that people make. Any other way up? What do you guys do when we go to rugby? How do you warm yourself up?
Hot chocolate.
Hot chocolate. Brilliant. So what we're going to do is get him a hot chocolate, fantastic drink. Something hot. Something warm, I should say.
A curry.
And then we're going to... not more curry at this point. And then we're just going to warm him up from there. Obviously, if his levels of response aren't good, get an ambulance, you know. So mild hypothermia, he should come back pretty quickly, okay? But the big thing with that is get them out of the environment and then gently and slowly warm them up. No hot baths, no hot showers, no sticking them right next to a fire, next to a radiator or anything like that. Just warm them up, get the wet clothes off and away we go. So we're also worried about what happens when people get too hot. So we've got two different things that we deal with hot temperature. So what happens? How would I know if you were overheating? How would I know if you were getting too hot?
You would start sweating.
Start sweating, absolutely. Why do you sweat?
Because the body's getting out. So isn't it the sun evaporating water?
Absolutely. So we sweat and the water evaporates and it takes temperature away. So sweating is the first sign. We call it heat exhaustion. Now we've all had that. You start to get a bit dehydrated, you've been out in the sun a bit too much, and you start overheating a little bit. Now, believe it or not, they'll start to sweat, they'll go pale on this one, so they'll go pale, cold and clammy. The skin might even feel a bit cold. Have you ever had it where actually you know that you're hot, but you feel cold?
Yeah.
Yeah, so that's a classic sign of heat exhaustion.
You might be sweating, but you're actually cold.
Exactly. They might start to get stomach cramps and things like that, feel a bit nauseous as well. Now, when it's heat exhaustion, it's quite minor. Again, we're going to have a look at it as if it was anything to do with the environment. Take them out of the sun, out of the environment, into a cool environment. We can give them a cool drink. So, Alex, have you got your water bottle there?
Yeah.
So, absolutely.
Be a sign, or would that not?
Yeah, so it might show me. It's shown me the environment that they've been in. Absolutely, there might be a bit sunburnt as well. And so we cool them down with that.
You could do the ice bucket.
Might be a bit extreme, but again, sort of cool water. I like when I know that I've had too much heat. Putting my hands and particularly my wrists in cool water, or cold towel or something like that on the back of their neck, or an ice pack. You might, when we go remote or when we're camping, we've got cool packs as well for injuries, but these just wrapped in a towel on the back of the neck are really, really nice.
Is it cold?
So not until we pop them. These are chemical ones, so we pop them and they go cold. We use those for soft tissue injuries at rugby. Yeah. So yeah, we've got kit that we can do that. But lots of hydration, lots of fluid. Now, what happens, and this is how I kind of remember it, is when they stop sweating. When they stop sweating, why do you think the body would stop sweating when it was trying to cool itself down?
Because it said that's not working. So
Yes.
it was trying something else.
Awesome. It's not working. So what the body does says, actually, it's not working. It's not cooling me down effectively. I need that water inside the body. So when they start to go red, hot, dry, flush skin,
Like sunburn.
banging headache, yeah. They might even have seizures as well because the heat's getting really, 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 really bad. We've got to cool them down quickly. Okay, this is almost like that, William. What we would do is we'd get almost like a blanket or a towel, and we're going to pour cold water over them. You know, we said with hypothermia that actually when you're wet, it conducts the heat away. We want it to do that this time, so we're going to get something like that and pour cold water all over it, and we're going to try and get that temperature down quickly. They are overheating if they're having seizures, banging headache, dry, flush skin. That's bad news that they've got heat stroke, okay? And that can lead them to die, to seizures and things like that. Obviously, when we're getting to this point, we're going to be wanting to call the ambulance, okay? This is where we need emergency help as well. So just remember that with anything with temperature, get them out of the environment, keep a constant temperature. So if they're cold, we want to warm them up. If they're hot, we want to cool them down. Again, with low temperature, the big thing is to do it gradually and slowly. Obviously, if we've got extreme high temperatures, then we want to be doing that quite quickly, okay? So that's our heat exhaustion, and heat stroke, and also hypothermia as well. Okay. So congratulations on finishing the video section of the course. Now, what we need you to do is the practical work. Make sure that you have completed all of that. I always find that if I'm trying to learn something, the fact that I've actually done it before really helps me retain the information. So make sure that you've had a go at the recovery position, you had a go at CPR, you've done the bandaging, choking, etc., etc. Now, what we need you to do is on our website, and there'll be a link to this below, is we need you to fill in a worksheet so that you can show your leader that you've actually gained the knowledge that you need to achieve the badge. So there'll be a worksheet for you to fill in. Anyone without a printer, there is an online version of that you can do as well. There is a second thing that we need you to fill out. It's a certificate, and that again is to be shown to the leader, and that's just from the guardian with you to say that the practical work's been done and that it's all been completed. Obviously, your leader's not with you, and I can't be there as well, so we just need your guardian just to tick you off to make sure that it's all been completed so that you can get your stage 3 badge. Now, well done, congratulations. We really, really hope that you've enjoyed it. There's lots of information here to take away. So thank you very much for joining us. Thank you from myself, and thank you from William and Alex. If you do have a second, please, we'd love it if you hit the like and share button on the video. Any nice little reviews on Facebook are so appreciated. They really help our business. But again, thank you very much for joining us, and well done.